All set?
Everybody got real quiet.
Yes, they did. Thank you.
I know, the gavel's.
And good morning and welcome to the January 8th meeting of the Joint Standing Committee on Health and Human Services. Our agenda today includes our child welfare quarterly update, as well as a report back from the Department of Health and Human Services on the GEA, the Government Evaluation Act.
Sorry, you've got an old schedule. You have. Somehow you've got left with an old schedule, just.
Okay,
Oh, no, that's right.
okay. Well, I'm using my old schedule from my,
Yeah.
okay, so there is
No,
no
this is right.
GEA. But that will come later this month. So we are today welcoming a number of citizen review panels, as well as our child abuse prevention plan and the Department of Health and Human Services, Office of Child and Family Services in for the Child Welfare Quarterly, which is required by statute. So just for those who may not be familiar with our quarterly updates from those parties, according to the Child Abuse Prevention and Treatment Act, or CAPTA, and the Children's Justice Act, 3 federally mandated groups of professionals and private citizens were formed to explore the work of Maine's child welfare system. These groups, called citizen review panels, are charged with determining whether state and local agencies are effectively meeting the safety, permanency, and well-being needs of the children and families throughout our state. So this is the order in which we will hear from those folks today. Leading us off will be Marriott Aborn and Melissa Hackett on the Child Safety and Family Wellbeing Plan, followed by Carolyn Jover from the Justice for Children Task Force, Erica Simonson from the Child Death and Serious Injury Review Panel, Amin Cabral on Zoom for the Maine Child Welfare Advisory Panel, Christine Albieri from the Child Welfare Ombudsman, and finishing up for the day with OCFS Director Bobby Johnson. I will turn to our committee members and my right and ask the committee to introduce themselves.
Thank you, Madam Chair. Good morning. My name is Representative Annie Graham. I serve the people of North Yarmouth and the majority of Gray, House District 105. Part of my job in this committee is to talk about the weather, and it is a beautiful Maine winter day.
Good morning. I am Lucian Daigle. I represent House District 1 in Northern Maine. And I biased by saying it's the best part of Maine.
Hello, good morning. My name is Flavia De Brito. I represent House District 64, which is part of Waterville and part of Winslow.
Hey, good morning, everyone. Sam Zager. I represent District 116, part of Portland.
Good morning. I'm going to disagree with Mr. Daigle, but anyway,
We may all
disagree, right? I'm Mary Ann Moore and I represent Senate District 6, which is all of Washington County, down East Maine, beautiful, and 16 communities in Eastern Hancock County as well.
Hi, I'm Michael Lemlin. I represent House District 53, Chelsea, Randolph, Pittston, and Dresden.
Good morning. I'm Representative Dan Shikori, and I represent House District 55, the communities of Hollowell, Manchester, and West Gardner.
Good morning. My name is Julie McCabe. I represent District 93, part of Lewiston.
And I'm Representative Michelle Meyer, serving Southern Maine's District 150, which is all of Elliott, where I live, and parts of Kittery and South Berwick. You may see committee members eating and drinking behind the horseshoe. We ask that those of you who are joining us here in the committee room, no eating, please, and drinking only of water. We appreciate that. You'll also see us coming and going. Some members serve on other committees or maybe introducing bills in other committees. So they will get up and leave and generally come back again. So with that, I also want to introduce our nonpartisan staff, Sam Seneft and Anna Broom, and our new clerk, Sophie Doobie. With that, I would welcome up the Child Safety and Family Wellbeing Plan folks, Mariette and Melissa.
Good morning, everyone. Just take a moment to get our slides up. I feel like that's working.
Technology worked.
Yes, success. Check. It's always a risk in the new year. Well, good morning, Representative Meyer, members of the committee. Thank you so much for this opportunity to provide another update on Maine's Child Safety and Family Wellbeing Plan. My name is Mariette Aborn. I am the Special Projects Manager for Child and Family Wellbeing at the Department of Health and Human Services.
Hi again, everyone. Melissa Hackett. I am a policy associate with the Maine Children's Alliance and the coordinator for the Maine Child Welfare Action Network.
We last had an opportunity to provide you all with an update on this work in the September Child Welfare Quarterly, but as a reminder, Maine's Child Safety and Family Wellbeing Plan is a partnership between the Department of Health and Human Services and the Maine Child Welfare Action Network. Going into its fourth year of this partnership, we released the most recent version of a statewide strategic plan to keep children safe by keeping families strong in February of last year. And this movement is really focused on what we want to promote within families and not just what we want to prevent. Today's presentation will provide a brief reorientation as we enter the new year of the framework underlying the plan, as well as a brief overview and reminder of the strategies. And then we will focus on updates led by the core team behind this effort, which includes myself, Christine Theriault, who is the Family First Prevention Services Manager at the Office of Child and Family Services, Melissa Hackett, and then Deb Dunlap, who is a founding member of the Maine Child Welfare Action Network. And with that, I will turn things over to Melissa.
Thanks, Mariette. So we've really seen the opportunity to provide you with a kind of high-level update and to focus on some specific areas of the plan. And there are several visuals that we've created to really support understanding and shared responsibility and understanding for what we're trying to achieve through this plan. So you'll see from this visual, this is kind of a core visual that we're using to help outline the broader system of child and family well-being, and to articulate the particular role and situation of the State Child Welfare Agency within that continuum. As with many systems, what we're looking at here is a continuum, and that ranges from universal supports that promote well-being broadly to interventions that seek to mitigate risk or harm around specific identified challenges, and crisis interventions when safety is a concern. And you can see from this illustration that the Child Welfare Agency's role is to intervene after children are already unsafe or abuse or neglect may have already occurred. And the much broader opportunity here is shared among other state agency and community partners to provide that proactive upstream support that promote the conditions for safe and supported children and families. And what we find in these conversations, and you've heard this in this committee, is often there's sort of a misunderstanding of the role of the agency, that the agency is responsible for all of that, and that really what we're seeking to do here is help articulate what their role and responsibility is and what the broader community and other state responsibility is here. That helps us not to just focus on the Child Welfare Agency's intervention, because then that's a missed opportunity to look at those proactive opportunities to support children and families, because we know that that proactive upstream support is better for children and it's less costly. The plan really outlines these opportunities in the upstream and proactive opportunities. Just took a second. So as we dive into Maine's Child Safety and Family Wellbeing Plan, and as Mariette was saying, it's been 4 years, that sort of took me by surprise. Sometimes it feels like it was yesterday. Sometimes it feels like we've been doing this work for a long time, as I think many of you will appreciate. But we're very proud of the work and of the partnership that really the work we're doing is shoulder to shoulder with community, with families, with other state agency partners. And really the way that we do the work outlines that shared responsibility and opportunity. And so what we're really looking at here is cultivating a movement in Maine toward not just what we want to prevent, but what we want to promote for safe and supported children and families. And this is not just a movement in Maine. This really mirrors a national effort to really understand what those upstream factors are that we know promote safety and well-being for kids and families and prevent the need for crisis intervention from the State Child Welfare Agency. Because we know that when we work together, we can support families earlier and again, create those conditions for safety and stability for children and families.
So as we focus on promotion and those positive conditions that we seek to create for families and in communities across Maine, this is a reminder of the goals and the strategies included in the 5-year plan released last year, which are oriented around 2 goals that put parents, caregivers, and families at the center of our work. And so those goals are that parents and caregivers can provide safety, health, and nurturing care for their children, and that families experience a supportive and coordinated child safety and family well-being system. The plan is oriented around 5 strategies to provide economic and concrete supports for parents and caregivers. The national evidence strongly suggests the connection between economic and concrete supports and family stability. Strategy 2 is to provide equitable and timely access to supports and services. This is really the bread and butter of what you all are thinking about on this committee at a regular basis. How do families get the supports they need at the right time? And then the other strategies beneath the second goal are to build partnerships with families. How are we working in partnership with families to develop these systems? Strategy 4 is around promoting supportive communities. What is the role that each of us have to play as neighbors, as friends, as professionals, as legislators in building these positive community conditions? And then lastly, improving coordination of state and community partners. As I mentioned at the outset, our update today will focus on initiatives within this plan that the core team is leading, but certainly this plan is much broader than that. One of the messages we really try to emphasize when talking about the plan is that this work is not held by one agency, one individual, or one community partner alone. That work is shared. And so we are in the process of developing an update on year 1 implementation of this plan to be released in the early part of this year to more comprehensively identify ways or provide examples of ways in which state agencies and community partners are putting this plan into action. So our updates today will focus on peer learning on prevention, a recent opportunity that we had with some other partners and parent leaders to learn about how other states are putting this movement into action, work on community collaboration, an update on the Be There For Me campaign, and lastly, an update on Maine's mandated reporting and community support initiative. Melissa and I both had the opportunity to participate in a year-long fellowship through the John T. Gorman Foundation last year. And as part of that fellowship, we had an opportunity to bring along other state partners for learning related to upstream support for children and families. And in December of this year, Melissa and I traveled with Rebecca Richardson, who works at the Office of Child and Family Services as the policy manager, Christine Theriault, the Family First Prevention Services manager at OCFS, Jamie Brooks, a parent-lived expert, and Heidi Acker, the executive director of the Maine Children's Trust, to visit 4 other jurisdictions to learn about how they are doing this prevention work. One of the things that we know is that Maine is not alone in this shift of looking towards what we want to promote within families and not just what we want to prevent. And so our objectives for this learning opportunity were to better understand how other jurisdictions are structuring prevention and investment, how they are thinking about community pathways of support and funding sources to support families within the community before child welfare needs to become involved, deeper exploration of how other states are investing in place and site-based family support, and then other mandated reporting policy and training efforts. This was a whirlwind trip of literally planes, trains, automobiles, subways, and walking.
We didn't do a ferry next time.
Next time is a ferry. But such a rich opportunity to be in community with state and jurisdictional partners, their community partners, and parent leaders in their communities, speaking to the ways they're doing this work, and also an opportunity for us to share about how we are doing this work in Maine. We are still in the process of gathering our learnings and takeaways from this trip last month, but look forward to sharing more with this committee and other partners about what we took away from that effort. But I will just say, and Melissa, I invite you to join in about any initial thoughts, but just very proud of the work here happening in Maine, how deeply collaborative this work is happening in Maine. This partnership is not something that we saw in any other jurisdiction we visited, and I think is a real strength to how this work is being undertaken here.
Yeah, I would just echo that uniqueness of the work that we're doing here, and also just the tremendous opportunity for these peer learning opportunities for some folks who have done some of the work that we haven't gone as deeply into, to be able to share some, lessons learned along the way that those are potholes we might not step in on our endeavors, and just really created some good relationships and opportunities for future conversations. But yeah, just a great opportunity to really see, the way the work is implemented in a place like Washington, D.C. versus a place like Bennington, Vermont is pretty different. But what are those core principles and values and partnerships that are guiding the work? And then how are they thinking about the families in the community as they're implementing these efforts? So a lot of learning, some work to go into synthesizing that learning, but just a great opportunity.
Yeah, go ahead. I'm just really curious. I love trips like that. I'm curious, do any of them, are they all under the Department of Health and Human Services in their state, or are they separate departments, or how did that break out as far as the organization?
It differed based on jurisdiction.
Okay.
Yeah. And I would say even the prevention work situation to the child welfare agency differed by the jurisdiction and by the state. So, and that these 4 sites, that tracks with what we see nationally, the structure and the relationship between those entities looks pretty dramatically different. Yeah.
The structure of the child welfare systems also differed jurisdiction by jurisdiction. Some had county-based systems of child welfare as well, which is different than the structure here in Maine. Yeah. Thank you for the question.
Carry on.
So the next initiative we're going to spend some time talking about is community collaboration. This was another funding opportunity that we had to take advantage of. We had really heard a lot in our community engagement sessions with folks that there may be folks in communities across the state who are bringing partners together to think about the community needs and to address those together, but they may not all be collaborating with each other. So you'll see the list below of the representatives that we included. I recognize sometimes when we talk about collaboration or convening, those can be a little bit wonky in terms of terminology, so we can unpack that a little bit. But what we're really looking at is the folks who may be part of a statewide network focused on a particular issue area, like the prevention councils focused on preventing abuse and neglect. They're bringing together certain partners in their community, but they may or may not be integrated and working with the public health districts, for instance. So what we sought to do is to bring together by region, and we did some work, and there's always imperfection in identifying geographic regions in Maine, right? All of these entities identify those regions slightly differently. But we sought to really bring those partners together to understand if there were opportunities to leverage, enhance existing community level partnerships, to identify opportunities in conversation with them about opportunities for action that they might take together, and to really have some clarity around steps that other state agency and community partners might do to engage in the work that they were already doing, or new efforts that might be identified. So we did that in 4 regions around the state: Millinocket, Farmington, Saco, and Rockland. I now probably have a credential in event planning that I didn't anticipate at the onset. But it really was a wonderful opportunity to bring those folks together, to hear from them, to really just the power of bringing people together in person, and folks really having a lot of gratitude for the opportunity to sit together, to think together about what the needs of the community were, and to think about opportunities that they might have to leverage the work together. And there were some key takeaways that we have already synthesized. There was some variation across districts in terms of needs or opportunities that were identified, but there were some commonalities as well. I don't think it will surprise the committee to know that basic needs of families was a considerable concern for community partners, recognizing that families are experiencing challenges to financial security, access to services, and that some families will experience that in a compounding fashion. Recognizing that the burden might be higher on some families than others. They also recognize that some of the typical and usual supports that families may have had access to in the past may be less available. And so there was a lot of conversation about how community partners might work to support local mutual aid opportunities, flexible funds that might be available to meet sort of in real time financial or other support needs of families. I would say folks are really proud of the work that they're doing in community. There was a real shared sense of purpose and readiness, even at what we know is a time of a lot of concern for folks. We did this in October, and the first convening that we had to the last convening that we had was sort of a heightened worry, particularly around SNAP benefits for November. So the conversation, even within 30 days, changed a lot across regions in terms of the worry. But community partners were really ready in those relationships and their partnership with families to say, what can we do? And so there was a real great opportunity. I think I neglected to mention on the prior slide, we had state agency partners who were part of those conversations, specifically to talk about some of the changes that are coming to MaineCare and SNAP, and to really ensure that those community members who are trusted messengers to families in their community were equipped with the knowledge and clarity so that they could support families navigating these changes. We had really good discussions about this idea of conveners, right? So there's doers and there's people that bring people together to figure out what to do, right? And those are different roles. And it's important that we have both of those roles in those community collaborative efforts. We need people to bring those partners together to think about what the common challenges are and to identify which partners can sort of take action to move forward solutions. And partners often named that while there were good opportunities with new funding opportunities to say, we want you to do collaboration, we may not be asking them to do that in a way that is most helpful to their work. They mentioned that they were often asked to create new collaborations. Well, for many of these folks, they may have been doing this collaborative effort in their community for 15, 20 years. They have the partnerships, they have the relationship, they have the process. We don't want to mess that up for them. So there was a lot of good conversation about how they provided information to us to think about how we're asking them to do their work and supporting them to do that work most effectively. And then there was a variation among communities. Some communities said, we've got this. We have our collaborations. We have our relationships. We're ready to go. We had other communities that said, we feel like we could use some more support or help with this. And so we're still kind of figuring out what to do with that in terms of how we might take action to support them locally. And then I think Marriott's included for those of you who want to look at the full summary of those takeaways, that is available, that link.
And I believe we passed that around to you as well. So the next update is on Be There For Me, which we have provided an update on every time we have sat in front of this committee. And so as a reminder, the Be There For Me campaign is a campaign to support parents and caregivers across Maine to reduce the stigma associated with asking for help and make it easier to find places to start to find support. The campaign and website were funded by the 131st Legislature. And additional campaign promotion has also been funded through the Preschool Development Grant. The Be There For Me campaign continues in earnest. While there is no current funding at this moment for paid promotion, the website continues to be maintained and updated. We continue to outreach to community partners and parents with outreach materials. And in October, McWan launched the Be There For Me Parent Reps, which is a group of 8 trained parents and caregivers who are identifying events in their community attended by other parents and caregivers to get the word out and represent this campaign and the website. We had another meeting with them last night, and there is just so much enthusiasm and excitement. There was chatter of what touch a truck events can we get to get out these materials. And just wanted to say how much the materials, which are available in English and 12 other languages, have been something that many partners continue to ask for. We had a connection with the Library Association in May and have now started to receive follow-up requests for additional materials to make available to communities across Maine. Since we last presented to this committee in September, we also presented at the Maine Principals Association Conference and included a presentation on Be There For Me, shared materials with those attendees, and also presented at the Maine Association for the Education of Young Children Conference and shared materials with those who attended there. We are awaiting some final data on the performance of the campaign. As I said, it just fully concluded on December 30th. And so we'll be taking some time to fully assess the performance of the paid aspects of promotion of that campaign and consider if funding were to be identified in the future priorities. I will say that I did share with you all a sticker, a Be There For Me sticker, as evidence of some of the materials. Would welcome you to share that with a parent who could use that message. Maybe it's you, maybe it's a neighbor, maybe it's a friend of yours. But we have many more materials, stickers, T-shirts, rack cards. And so if you know of any community events that a Be There For Me parent rep could attend to share this message, please be in touch. We want to bring this message to every parent and caregiver across the state. Anything else to add on that?
Quick question from me. How's traffic been on the website?
The traffic has been strong. It is stronger when there is paid promotion as compared to when there isn't. Again, we haven't had a chance to fully dig into the data. I can say that we did hear from the vendor managing the website and campaign that in October, they saw a significant uptick in visits on the food page. So
Right.
understandably, that was something that parents and caregivers were looking for. And we were glad to hear that Be There For Me was a place that people knew to go to for support.
And I think all the committee members are aware that, or have hopefully been to the website, which is it's in one place, a one-stop shop for all of the many programs and services and doors that folks can open and walk through when they are identifying a need that is placing their family at risk of either not being able to maintain a roof over the head of Maine's children or put food on the table, when there is concern or worry that they will lose their health benefits, any number of supportive services that keep our kids safe, healthy, warm, fed, and those families able to, in the privacy of their own home, which I think makes a big difference. When we first discussed this program, we talked a lot about stigma. And I think your work in the communities and focus groups and with parents and individuals with lived experience identified that it is the stigma of reaching out for help. There's also information about general assistance and some other programs that are simply not well known to many Maine families. So traffic there, and what you're saying about no paid promotion, we're seeing that paid promotion initially was driving individuals, Mainers, to the website, and now how are we lacking funding for the paid promotion? We're using social media. How are we getting the word out?
I'll let Marriott answer the question about how we're getting the word out now when the paid promotion is ending. I would be remiss in not naming that McQuan did work on legislation last session that is on the appropriations table. This committee heard that could provide one time and another year of funding toward Be There For Me paid promotion.
Thank you.
Thank you for the question. The paid promotion was just one aspect of a comprehensive outreach strategy to raise awareness of Be There For Me and get the word out there. And so we continue to move forward on the rest of the fronts. The social media pages for the Be There For Me accounts are being transferred to the department, so we would be able to maintain those. But we continue to reach out to community partners and other trusted messengers to share those physical materials, which we have had a very robust response to. We have I believe distributed almost 30,000 rack card materials to community partners across the state, and will continue to do so.
I would also add that was some of our thinking with the Be There For Me parent reps. Marriott and I can go and talk about Be There For Me. We love this program. We worked really deeply with parents to develop the website and the resources, the way that parents want them to be represented and to interact with them. And it is different when a parent who's experienced challenges is talking to another parent about this opportunity. And so that really is another initiative that we're excited about, that is going to be parents going out directly talking to other parents, really reducing that stigma, offering this as a resource and really helping to help parents navigate through it.
Sam, Representative Zager.
Thank you so much. This seems very intuitive, very valuable to address the upstream issues, prevention, reduce stigma. In your discussions with experts from around the country that or around the region that went to those various communities from DC to Bennington, how are they tracking qualitative or quantitative metrics to know that it's working or to validate that it's working so that continued funding can be secured?
Sure. Yeah. I would say, I feel like I've answered this question from Representative Graham several times. Prevention is hard to prove, right? The absence of something is hard to illustrate. And yet we can talk about measuring protective factors for families. We talked about this with other jurisdictions. And Maine has participated in national convenings beyond these 4 jurisdictions of efforts that folks are doing, whether that's public messaging campaigns, or other ways that they're promoting upstream support for families. But I do think, to your point, there are a lot of folks talking about the need for the qualitative and the quantitative approach. I'm thinking in particular of some of the work that folks are doing through family resource centers and other site-based places where they're really trying to think about where was the family at when they entered? What did they gain from that? Do they feel that they are more supported? Were they able to access supports and services? So thinking about kind of measuring where families were before they engaged with support and where they were after that. And I would say that the protective factors are something that a lot of folks named through that particular model as a way that they're measuring that.
Okay.
Do you want to speak to anything else?
Thank you. Appreciate it.
I would just add that lots of folks are very jealous of Be There For Me. And they say that to us because the thing that I would say is it needs to be as easy to support a family as it is to report a family. And having community partners know about this resource as an easy place to refer a family to start to find support is a real benefit to that engaging with families. A lot of community partners and neighbors will say, I don't know what to do to help this family. And if we can make that simpler for them, it's being able to really create that bridge to support for folks. So I really think it functions in that way as well.
That brought up a really good question too. Does 211 know about Be There For Me?
Yes, we have
Okay.
collaborated with 211. They're aware of Be There For Me. 211 is a much more comprehensive list
very,
of
very much so.
resources.
It just
and
made, they were talking about this morning on, I don't know, Good Morning America, whatever, and how it's nationwide. You know,
Mhm.
I thought about how we really worked hard to promote 211 within the state of Maine. And now we want to promote this as well. And that's why I was curious if that is one, if somebody calls in for children resources, that they could refer them to Be There For Me.
Yes, that's
Good.
a great question. Be There For Me also does refer to 211. So when you go
Perfect.
to any of the Be There For Me pages, we feature what we think are the places to start to find support and then always refer to 211 as the most comprehensive directory of resources. Would also be remiss if I didn't uplift the partnership between 211 and Help Me Grow Maine. 211 option 5 will connect a family directly to Help Me Grow Maine for support. And so we also heavily feature Help Me Grow on the Be There For Me website because it is a model that allows for a follow-up through 60 days to refer and be a centralized access point for parents, which is something we heard was very much needed and wanted. And we have that model already through Help Me Grow.
Thank you.
This is a good bridge and also a following back up on Representative Zager's question. I'm now prompted by this next slide. Not specific to Be There For Me, but what comes to mind in terms of measurement that was another example was with New York City, where they had done a lot around training and education to different kinds of mandated reporters in the city. And they really partnered. So if they were talking to hospitals, they partnered with somebody in the hospital, somebody from the agency went out with them and did that education and training to really guide and support appropriate identification of suspected abuse and neglect, and considering how to otherwise support a family if a community response is more appropriate. And they were then measuring, they'd done something like 200 engagement sessions with folks, and they were measuring the reduction in reports related to that. And I would name as part of this mandated reporting work, one of the sort of foundational data points that we have is that around 90% of reports are not indicated or substantiated, 90. So there's a real opportunity to think about how do we support mandated reporters to understand, appropriately identify what is suspected abuse and neglect and what is, like, for instance, a family resource issue that could be more appropriately met by a community response. So there's also opportunities within the agency to have those considerations of what's getting screened in and investigated and substantiated. But there's a tremendous opportunity at that sort of front door to think about how we support mandated reporters to really understand the needs of the family.
Thank you. That's helpful. You said that was in New York City, and who was it the New York City Commissioner, Health
Is
Commissioner?
there
or something?
Division of Family Services? I might not be getting the name
Okay.
totally right.
Administration of Children's Services.
Okay, so,
Yeah.
okay. Thank you. That's.
We can
that's-
provide it in the follow-up memo. Everybody's structured a little bit differently, but yeah, it was their Family Services Division, really talking about the supports and services that are available through state contracts, and partnering with educators, hospital providers, those professionals when they're going out to do education and training to those professionals.
It's really fascinating because they have that like self-selected group of people who are clearly plugged in, they're paying attention. They could maybe use some training to make sure that resources are provided the vast majority of times when they're also on the lookout for, that those rare and very unfortunate, situations where something needs to be reported. So
Yeah.
thank you.
That's a good segue to the good work we're doing here in Maine. So this mandated reporting and community support for families is an initiative that came out of the Child Safety and Family Wellbeing Plan. It's become a fairly large initiative. We've been working in partnership with OCFS to lead this work. It launched in July of 2024. We sort of yielded our summer to launching into this initiative. And it's been a really profound opportunity to bring together a work group comprised of different kinds of mandated reporters, as well as a steering group of different leadership from OCFS and other community entities, as well as families with lived experience, to think about what is the role of mandated reporting and what is the opportunity to support families in the community. And that work really started by figuring out what do we need to focus on with this work. And we focused on the definition of child abuse and neglect. I think you all are aware states have a lot of latitude in how they define abuse and neglect, how their state agencies intervene when abuse and neglect is suspected. And then really looking at education, support, and training to mandated reporters, and also thinking about what are community pathways of support for families. This sort of easy route right now is to report a family and assume that child welfare is going to intervene with that family. And we need other tools in our belt to figure out what is the most appropriate intervention or support for that family. So exploring what those community pathways of support are for families. That work led to legislation that you all considered and passed last session that went into effect in September that clarified that family poverty is not child abuse and neglect. Around half of the other states have already created that sort of statutory clarification. Maine is now part of that group. And we are working on implementation to make sure that mandated reporters are aware of that change. And also we're finding as we are implementing, people are very quickly saying, well, then what else do we do with that family? And so again, it leans into that need to identify those community pathways of support for families, make sure mandated reporters understand the resources that are available to families in their community. And there's also work within OCFS to update caseworkers and other staff on that statutory change. We're now deep in a redesign of the core mandated reporter training. And to your point, Representative Zager, this training will be for all mandated reporters. It is the one that is required by law. But we are next looking to how we could create specific modules for certain types of mandated reporters. We know that identification and reporting of certain types of concerns are more or less challenging for different kinds of reporters. And so very quickly after we've finished this core training, we will be looking to bring together partners in those sectors to identify what training, education, and support would be helpful to mandated reporters around those specific topic areas. I'm really proud of the robust work that's gone into this redesign of the training. It is a significant redesign. Is really responsive to what mandated reporters have told us they struggle with in terms of understanding and identifying, navigating the reporting process. And it includes a lot of content about how you might otherwise support a family. And frankly, even if you have to report a family, how you might also support a family. And so there's a lot of sort of coaching, education, resources that are provided to mandated reporters to think about that role as well as their role as a family supporter.
Go ahead.
Help me remember, how often do they have to take the training?
It's currently 4 years.
Yeah,
You will hear legislation this session that will suggest that it is more frequent than that.
good. That's why I was curious about.
Yep.
Thank you.
And I will say it's required every 4 years. We would love people to take it as frequently as they feel they need to. We often heard from mandated reporters that a one-time training is insufficient to really support that real in-time decision-making. We're really encouraging mandated reporters to identify somebody in their organization that they might consult with, particularly for people who are new in the field. Really wanting folks to feel that they have ongoing support in that challenging role.
And that concludes our update for today. I just wanted to thank the committee again for this opportunity to provide an update on this work, and also for the roles that you all play as part of this movement alongside us to strengthen families across Maine and keep children safe. So thank you.
Thank you. Go ahead, Representative Graham.
Thank you, Madam Chair. Something that strikes me as we heard, and thank you for your work. I've been very impressed. I went to one of the presentations and listened to the parents, and I really putting myself in their shoes and trying to really understand. One of the things that strikes me though is that many of the tragedies we see, experience in the state is often because of isolation. I think of our kids in our rural areas, but you can even be isolated in the middle of Portland. And so can you talk with me a little bit about how we reach those families that are isolated? It's a huge problem. I anticipate that some of these moms and these parents will understand kind of how to do that. But can you talk a little bit about some strategies around that and maybe what other states have done?
Thank you, Representative Graham, for that question. This is something that we talk about a lot because we heard about it a lot from parents and caregivers, as you have also this sense of social isolation, this lack of connection. And as you said, this could be in a small town and it could also be in a very, in Maine's more urban areas. One of the initiatives that we're in the process of developing right now is figuring out how to measure this. And there is a lot of national work happening around social isolation. And I would just say I wanted to uplift some of the nuance that parents and caregivers who have shared this with us have offered, which is that it's about someone who cares about me who's not paid to do so. And so I try to hold that and really thinking about how do we create those social opportunities. I know our prevention councils host play groups, sort of informal social opportunities for parents to connect. As it relates to the Be There For Me message, I think that is in part our hope of what those Be There For Me parent reps will do. They are parents who are in that community who themselves may also feel or have felt isolated in some way. And Be There For Me really offers an opportunity for that kind of connection in community spaces.
There's a relatively new nonprofit called Community Plate that you may have heard of. They were my constituents, and it's an amazing organization, a group where it's just a potluck supper, and you all get together and you tell stories and you bring your recipes, and it's a lovely, simple model. And it'd be really those parents all getting together and doing that. Vivek Murthy has done a lot on social isolation and how it's actually an epidemic, which is causing many of the issues that we face. So thank you.
Thank you for that, Representative Graham. We are aware of the Community Plate effort, and just wanted to underscore that this work can feel very big. It can feel very complex, and at times it can feel very heavy. And we talk a lot about shared responsibility, the roles that we have as individuals, as professionals, legislators, state agency staff in this work. The social isolation piece is the biggest opportunity for all of us. It doesn't take much to offer a moment of connection with a parent or caregiver that you might see in the community. And so, would welcome you sharing that message with your constituents. The Be There For Me website has a page called How to Be There For Me with 10 easy tips on how you can be there for other parents. And one of those tips is sharing your own story. And so I offer that as something that we can all take away to carry this movement together. So thank you again for uplifting that. I think Melissa has more to say.
I mean, I just want to plus one that it is those community-driven, community-based opportunities. It's the bean suppers that we don't have anymore, right? And so I really think just thinking, we tend to think about intensive supports and services. Those are important when kids and families need them. And it is not a replacement for people in the community that families feel they can reach out to when they need support, right? And so they need to have both of those things. And I think there's often a public perception or assumption that families have that support, and many of them don't. Many of them don't have family nearby or friends and neighbors that they can count on. And oftentimes that's what families say makes the difference for them. It's not the paid professional, it's the neighbor they can go to and say, oh my gosh, I need help with childcare today. Can you help me? Or, you know, I'm really having a hard time right now with putting food on the table and making a casserole for them. It really is like taking down the perceived judgment that families feel. The grocery store came up again and again. Parents are terrified to take their kids to the grocery store because everybody's going to judge them when their kids are hanging off the cart and grabbing things off the shelves. And just looking at a parent and saying, I've been there. It's okay. You're doing great. It makes a difference. That accumulative effect of feeling supported by the community when you're having a hard time makes a real difference.
Go ahead. Thank you. Thank you very much for the work that you guys been doing. It's really great. And also for me being a parent and also being a parent that advocates for other parents. So my question is like when a parent is advocating with other parents to use some of these resources, and I know that you said something about basic needs, and then you have a parent that refers another parent to some of these resources, but then there's a bias or there is a the parent can't get some of these resources. Can you talk a little bit more about it? Like, what are you hearing from parents when they refer other parents to some of these resources and those resources are not available for them?
Yeah. I would say something we talk a lot about with Be There For Me is that obviously we can't create supports and services that don't exist or sustain them if they're not going to be sustained. What we can do is provide the most up-to-date information about what may be available. Parents stress that we prioritize people that they can speak to, so care coordination or resource navigation as a priority resource. And then we are really talking with the parent reps about how we can gather feedback from parents. We're also sensitive to not burdening parents as they're navigating the site or accessing resources to tell us how that went for them, right? But we do want to know if that is effective, if it's working, if it was supportive. So we are talking through that with the parent reps in particular about when they're working with families, when they're talking about it, how they might gather stories and responses to how that process went for them. Yeah. Anything you want to?
I think too that building off Representative Graham's comments about social isolation and the work that Be There For Me does in order to, in sort of a one-stop, here's what may be available, here are the services and supports, and directing folks. We also have site-based family support, family resource centers, sort of in discussion. I've been to Washington, D.C. With Casey, where their family resource center system is impressive. We have down in southern Maine, Mainspring, which is a resource center, everything under one roof, including the local food pantry, the housing organization, case management. So there is several individuals. There is no wrong door to all of these programs. Making sure that these programs and supports are funded and available to the people they need them is our job. It's our job as legislators. So could you talk just a little bit to conclude your presentation here about family resource centers and site-based family support and what you've seen out there and what you believe may be the future here in Maine?
I'll begin and then I'm sure Melissa will have more to add, but I will say that places where families can gather and access supports is one of the actions named in the plan. And that is in response to feedback we heard from parents, caregivers, and community partners about what is needed and what would be helpful. The 131st legislature also provided funding that the Maine Prevention Councils were contracted to lead a community-based spaces for families initiative. We have a summary about that initiative that we can share with the committee, but we defined community-based spaces as low barrier, no cost spaces where families can access information and referrals, and strengthen at least one protective factor for families. And so that effort was undertaken in 2024 and identified more than 3,000 community-based spaces for families across the state. The structure of that initiative was really grounded in an understanding that we know that there are lots of places like this that already exist in the state. Representative Meyer, you named Mainspring as an example, and really seeking to bring partners together to say, okay, these are spaces families have identified, are supportive, and offer these aspects. And how might we as community partners come together to consider how to strengthen or expand those spaces? On our state learning trip, we did visit many different models of family resource centers with many different names: family enrichment, family opportunity, parent-child,
Family success.
Family Success Center. I would say you saw one family resource center, you saw one. They were all very different, and jurisdiction by jurisdiction had different goals, but really shared in common this prevention focus for families. And so we are continuing to pull together some of our learnings from that trip. But also I'm aware of communities who themselves are starting to think about how to bolster some of these existing spaces or create new ones across Maine.
You nailed it.
Thank you for everything and this presentation.
Thank you.
We're grateful. Moving on, I would ask Carolyn Jova from the Justice for Children Task Force.
Good
Welcome.
morning, Representative Meyer, members of the committee. It's very nice to be here. Thank you for your time. My name is Caroline Hova, and I'm here on behalf of the Justice for Children Task Force to provide an update on the work of the task force. By way of background, I think you mentioned earlier that the Justice for Children Task Force is one of the 3 main citizen review panels required under CAPTA in Maine. What makes the Justice for Children Task Force a little bit different is that it is chaired by the Chief Justice of the Supreme Judicial Court, and it tends to focus more on court issues. So more of a direct, sometimes indirect, but more of a focus on the court. The mission, of course, is to enhance child welfare outcomes for children in Maine. It shares that mission with the 3 other citizen review panels. In addition to Chief Justice Stanfill as our chair, the task force includes professionals in the child welfare field, including parent attorneys, guardians ad litem, members from the department, assistant attorneys general, et cetera. Throughout the year, the Justice for Children Task Force identifies opportunities for systemic improvement, and then also collaborates on solutions to try to, again, improve overall outcomes for families. The task force meets quarterly. Typically, we meet in March, June, September, and December. And the format is virtual. The benefit of the virtual format is because it is multidisciplinary in nature and really includes folks from across the state. It really has actually improved participation to have that virtual option. The way the meetings usually work is that we provide a space for updates from the 2 other citizen review panels. The purpose of that is to really ensure some cross-pollination occurs and that we don't have duplication of effort and that we're really enhancing each other's work rather than, spinning our wheels doing the same thing and duplicating our work. After updates from the citizen review panels, we also provide a space for updates from the court, from the department, from the Office of the Attorney General. And then we move on to updates as to the strategic plan of the task force to make sure that the task force at large has an opportunity for comment. I will say a lot of the work happens at the subcommittee level, but the subcommittees meet certainly much more frequently than quarterly. But again, those quarterly meetings is kind of an opportunity for everyone to come together. In 2025, the Justice for Children Task Force focused on 2 big initiatives. One was parent attorney and guardian ad litem recruitment and retention. In order to address this, the subcommittee formed, the task force formed a subcommittee that studied this issue, meeting on a monthly basis, and then presented a series of recommendations to the task force. And to really allow for in-depth discussion, those recommendations were actually presented over 2 meetings in January and March of 2025. At my last update to this committee, I mentioned the work of this subcommittee and touched at a very high level about the themes of those recommendations. But today, what I wanted to give you is a more concrete update on some of the key recommendations and their implementation. So I'll start with the recommendation of the subcommittee that Public Defense Service, the Maine Judicial Branch, and the Office of the Attorney General implement an exit interview protocol for parent attorneys, guardians ad litem, and assistant attorneys general who are no longer working with a protective custody docket. Again, to have a better understanding of what is causing some of the attrition to the extent those groups are seeing that. And then, sometimes that can be the result of retirement or, something that really cannot be controlled. But to the extent that it does shed light on opportunities for collaborative work to improve those issues. The subcommittee really felt like that data, and especially the sharing of that data, could be helpful. And so with respect to guardians ad litem, an exit interview has been created for all guardians ad litem who, again, leave the roster. It was intentionally kept really short so that it's not overwhelming, and really to kind of encourage guardians ad litem to respond to the survey. I think it's 4 or 5 questions. And the survey was shared with Public Defense Services, who I think also have their own exit interview, but we're going to look at this kind of short survey format to see if it could maybe enhance or supplement their protocol. The Office of the Attorney General shared with the subcommittee that they already have an exit interview and actually recently shared with the subcommittee some of the data. And the plan moving forward is that the data will be shared annually at the task force meeting. I think we're going to be aiming for the December task force meeting.
Yes.
Yes, of course.
Caroline, how many gals do we have, guardian ad litems?
I think approximately around 150, but I can double check
curious,
that
yeah.
number
Because I
and
know
provide
that-
it to the
Yeah, we
committee.
need them. We always
Yes.
need them. And that's why I was curious.
Yes, especially in some of the more rural areas of
Correct.
the
That's what I'm
state.
thinking.
For example, Aroostook County is a county that could certainly use more.
And Washington County as well.
Yes, of course.
Yeah.
And so the subcommittee has definitely focused on the need for guardians ad litem throughout the state, including in the rural. And a lot of the recommendations that were made were aimed at having kind of a statewide increase or enhancement in the rosters, not just, in the more populated parts of the state.
Thank you.
Do we have any idea how many more guardians we believe we need in order to meet the need?
That's an excellent question. I mean, to date, the guardian ad litem roster has been able to, for the most part, keep up with the demand, but we are starting to see signs in some, again, of the more rural courts, contacting the guardian ad litem services office at the Maine Judicial Branch by clerks indicating that they're having a hard time finding a guardian ad litem. For the most part, we've been able to secure a guardian ad litem, but it is starting to pop up.
Mhm.
I wouldn't say with the same rate that we're seeing with parent attorneys, but it is, I would say the roster is just barely keeping up. In terms of how many more specifically, I mean, where we're meeting the demand and starting to see some gaps, I don't have a precise figure, but it is certainly a point of focus for the task force and the subcommittee to just make sure that we don't really fall behind and create a backlog of cases that don't have a guardian ad litem.
Thank you.
Yeah.
Yes, Representative Shigori.
Yeah, hi, thank you for your presentation this morning. I know a number of the parent attorneys are private attorneys that are just doing this pro bono. And there's a great shortage there as well. Is there any outreach being done to those that are doing that to try and get ways to encourage them to either stay doing it or to get more of them to do it?
On a pro bono basis?
Yeah.
Yeah. So, I mean, I think I'm not exactly sure what the numbers are in terms of our pro bono work in the field. I do know, for example, with pellet work, the Supreme Court made some targeted outreach to firms in the area to encourage attorneys from some firms to take appellate cases. A lot of the firms at these in the state of Maine have attorneys who in the past, for example, served as law clerks for the Supreme Court and so are familiar with that appellate advocacy aspect of it. So, you know, I think that has helped to some extent. I've heard from the Chief Justice, she has reported that, you know, we have seen some firms step up, but there is still a need and it continues to be a focus of the task force.
Right, but has there been any outreach to the actual attorneys that are doing it to see how maybe they could encourage their peers or how that, you know, that could be a friendlier process for them?
So that would be an excellent question, I think also for the, for PDS, right? Because they're mostly focused on and we have members of PDS serving on the subcommittee. So I'm happy to bring that question to the subcommittee and bring that information at our next quarterly update. I'm not exactly sure what efforts. I do know that PDS has been studying this very carefully, but I can bring that back to the committee. Yeah. The next recommendation that we wanted to highlight today is of the subcommittee was that the Supreme Judicial Court amend the civil and criminal court rules to allow students of an ABA accredited law school to receive student practice authorization for internships and externships and contract counsel supervised by PDS. So to this end, the Maine Supreme Judicial Court did launch a pilot project to conditionally authorize law student externs to provide public defense services under the supervision of PDS contract counsel. That started December 18th of 2024. And representatives of Maine Law who serve on the subcommittee of the task force have indicated that interest in this program is starting to build and have offered to gather and share data with the subcommittee. The pilot program expires on September 5th, 2026. So we anticipate that the Supreme Court is going to be looking at that data to determine whether to extend it. But based on what our friends at Maine Law are reporting is that, again, it is starting to build and it is offering, again, yet another opportunity for students to gain exposure in this field of law, with the goal being to incentivize them to potentially consider this once they are licensed.
Stay where they're
The next recommendation I wanted to bring to your attention was a recommendation that the judicial branch should prioritize implementation of an electronic billing system for guardian ad litem billing. So to this end, on August 13th of this past year, the judicial branch transitioned to electronic submission of guardian ad litem vouchers. In courts that have already implemented Maine eCourts, that submission is through eFile Maine. In the courts that have not and are still paper-based courts, the submission is through ShareFile, which is a secure uploading software that can be used. Vouchers are also internally processed using ShareFile, and we have found that moving away from paper and the Postal Service, not surprisingly, has improved the efficiency of the processing of these vouchers. The goal really is eventually to implement a more robust electronic billing system that would, for example, allow guardians ad litem to be able to check on the status of their voucher, on a portal. Right now, in order to get that, they email the guardian ad litem office at the administrative office of the court and receive that information, but it's a more manual and laborious process. So there has already been some work to start mapping out such a system. But implementation is still a few years away, given the need for more funding, but then also primarily, frankly, the limited capacity at this time of the judicial branch's information technology department due to the statewide implementation of Maine eCourts. We're now entering the rinse and repeat phase of the Maine eCourts implementation, which is going to be fast and furious and all hands on deck. So it is taking up a lot of our IT resources, but we expect that after implementation of Maine eCourts, there will be just some more capacity to turn to this important effort. But in the meantime, at least the electronic submission and processing is improving the processing times of guardians ad litem's vouchers, which certainly is, something that we hope will encourage guardians ad litem or folks who want to become a guardian ad litem to become rostered and certainly, not create any attrition. Of course.
Yes.
What do we pay our guardian ad litems?
Yeah, so guardians ad litem statutorily have to be paid the same as parent attorneys. The rate currently is 150.
150 an
Yeah,
hour.
an hour, of
An
course.
hour.
Yep.
Okay, thank you.
The next recommendation was a recommendation that the law school offer its child protection class each year and consider adding a clinic that is focused on child protection. I mentioned earlier, Maine Law does have representatives at the subcommittee. They were very happy to report that a child protection course is in fact being offered the 2026 semester. It is being taught by Assistant Attorney General Hunter Humphrey. Students always report that his class is absolutely fantastic. So we were thrilled to hear that Attorney Humphrey's continuing to do this. Maine Law intends to continue to offer this course, provided a qualified adjunct professor is available and willing to teach the course. So all fingers crossed that this continues. PDS is also exploring the creation of an additional course, potentially at the law school, that would satisfy the PDS minimum standards requirements to be rostered as a parent attorney. The law school currently offers a bridge course that allows folks interested in becoming a guardian ad litem after graduation the opportunity to satisfy the core training requirements that they need so that rostering can occur more quickly upon graduation. And so there is interest in, again, offering a bridge course. The current course that's offered is more of an overview of child protection law. This would be aimed more at the parent attorney role and making sure that those minimum standards requirements can be satisfied.
Yes.
Yes.
The individuals who want to become guardian ad litems, they do not have to be attorneys, do they?
That's an excellent question. So it's a little bit nuanced and that it depends. So if you want to become a guardian ad litem and take Title 19A cases and 18C, certain professionals with mental health qualifications, for example, licensed clinical social worker, can qualify for that. For Title 22 cases, child protection cases, to be on the guardian ad litem roster, you do have to be an attorney. In Maine, we also have the Maine CASA program. CASAs do not have to be attorneys. They can be they are volunteers. Some are attorneys, but not all. But they are supervised by legal service advisors who are attorneys, and they're part of the Maine CASA staff. So it's a little bit of a nuanced answer. Yeah. So with respect to the recommendation as to the clinic, Maine Law does not currently have a child protection clinic, but it does have a general practice clinic that does occasionally accept referrals of child protection cases, particularly cases that do not involve a change in custody, those straight petition cases. The establishment of an additional clinic specialized in child protection cases would require some significant funding and infrastructure that is not currently available, but representatives from Maine Law who serve on the subcommittee have certainly taken note of this recommendation. And again, emphasize that at least in the interim, their general practice clinic does occasionally accept some child protection cases. The other initiative that the task force focused on in 2025 is continuing education for child protection professionals. So to this end, the task force organizes an annual conference, the Child Protective Confidence, that's put on by the Maine Judicial Branch with federal funding from the Court Improvement Program grant. It is usually held during the Judicial Branch's Spring Administrative Week. And planning always begins the September of the preceding year. So we are deep in planning for the 2026 conference. The conference offers an opportunity for professionals to gain strategies to better support children and families involved in the child welfare system. In 2025, the conference focused on improving family outcomes through effective communication in high conflict cases. We worked with the High Conflict Institute and presented on such topics as flipping the script in high conflict cases, conflict tolerance, using a structured proposal method for reaching agreements, managing high conflict personalities in court, and communication between teams and groups. For 2026, we're shifting gears and doing things a little bit differently. There was an interest in more trial skills training. We did this in 2021, partnering with the National Institute for Trial Advocacy, NITA. It's considered the gold standard for trial skill training, and professionals gave rave reviews that it was a fantastic interview. And since we've hit that 5-year mark, we're hearing that it was an opportunity to kind of return to that and provide an opportunity for attorneys to brush up on that. So the 2026 conference will be virtual. Again, we did this in 2021. The virtual format helps because it's a 6-to-1 ratio. So 6-to-1 participant to faculty ratio. So it requires a lot of breakouts. And so that Zoom breakout feature actually is very helpful for that kind of, for this type of training. And the wonderful thing about the National Institute for Trial Advocacy training is that it's very interactive. So participants receive a mock case file that they're asked to study and read prior to the course, and then they have to do mock direct examinations, mock cross examinations. We're also going to be focusing on exhibits and impeachment. So they practice those trial skills in real time, and then they receive individualized feedback by NEDA faculty who are all highly experienced trial attorneys. In addition to the trial skills, we will also offer an opportunity for an ethics course. We're going to be focusing on artificial intelligence in the context of child welfare. It's a topic that we're all thinking about. And so that will also be offered virtually the day before, but just an additional opportunity for folks to get an ethics credit, but also to get some really helpful information on a topic that is not going away and that we need to, make sure that we're using artificial intelligence in a way that is helpful to the families, but also doesn't cross any ethical lines. So, in conclusion, the task force continues to put forth initiatives that are system-wide, call for system-wide improvements. It's collaborative in nature. And, we'll continue to meet this coming year to continue its work on guardian ad litem and parent attorney recruitment and retention, additional continuing education for professionals, and any other topics that come to the task force's attention. Thank you very much for your time today.
Thank you. Any questions? Attorney Hova, I want to first of all apologize for mispronouncing your name.
It happens all the time.
Yeah, well,
Don't worry.
believe me, I know. My name is yes, that's right. So many variations on our names.
Yes.
But thank you for being here and for an excellent presentation.
Thank you very much for your time. Have a good day.
Do we need a 2-minute break or are we ready to move forward? Please come on.
Ready to go.
Ready to go. Welcome.
Thank you. Good morning, Representative Meyer, members of the committee. Thank you for having me today. My name is Erica Simonson, and I am the chair of the Child Death and Serious Injury Review Panel. You may recall in September, I was joined by Dr. Nicholas Miles, who was the co-chair. Dr. Miles will be attending these regularly. He couldn't come today, and he was very sad because we're going to talk about topics that he's passionate about. And so there will be a couple times through my remarks today where I'll be like, call Dr. Miles because he's interested in sharing more insight with folks around particularly our level 2 reviews, which we'll get to in a second. So I wanted to acknowledge that. My update today is for October through December of 2025. I just want to note for the panel that we have already had our January meeting, so that's in the books, but we'll be trying to keep the update sort of within our quarterly timeframe. We did not meet in November. We opted not to meet because that was the timing of our meeting coincided with the Child Maltreatment Conference that Spurwink holds every year, and a lot of our panel members attend that training, which makes a lot of sense. And so we just met in October and December for this last quarter. I also provided for you, and I'm going to email this along after, I gave you a copy of some of the high points of my remarks. At our last meeting in September, someone who I don't remember who, had asked where Maine ranks nationally as far as child death. So I provided some high level statistics for you all. I want to name, these are not CDCERP statistics. These are statistics that can be found through the Annie E. Casey Foundation Kids Count Data, which is really accessible through a Google search. And so folks that want to look at that more, please feel free to. I have, in a very limited way, able to speak to that because it's not our data, but wanted to bring that back for folks because I said that I would in September. Most of you know that we are also a multidisciplinary panel. We're also one of the citizen oversight panels that's mandated through the Child Abuse Prevention and Treatment Act. We are specifically reviewing child death and serious injuries and making recommendations to stakeholders, statewide partners that are integral in responding to those tragedies in our state, and really how we can change the outcomes of some of these tragedies. First, I'll talk about our panel updates, and then I'll tell you about the case reviews that we engaged in over this last quarter. When I came in September, I talked about the panel considering some bylaw changes around how we engage in our case selection process. Our panel did a lot of work over 6 months to gather a lot of information from across the nation, from other states, fatality review panels, from national technical assistance providers, as well as the experts in our state around what sort of information do we consider when we're engaged in case selection of what cases we're going to review. I'm very thankful for the 6 months that we were able to spend doing a really deep, comprehensive look at this issue. And ultimately, our panel has voted not to change our case selection process that we have currently in our bylaws. One of the things that our panel did know as we were saying that we aren't going to make these changes is that we want to continue to approach this multidisciplinary work by hearing from our panel membership about why we should or shouldn't review certain cases and the impact that those reviews have on maybe pending cases that are pending protective custody and things like that. And so we want to continue to join to get all that information that's pertinent to identify what our best case selection process looks like. And so just wanted to provide that update for folks. We did get direct feedback in this sort of national look from 16 other states directly who provided us feedback around what their case selection process was and had an opportunity to examining the governing statutes from at least 40 other states. So it really was a comprehensive look. And one of the things that I would note is, and you heard this earlier, around sort of like what do processes look like in other states. There was no sort of guiding principle. No state had sort of really hard and fast way that they did things. So we couldn't find like, oh, this seems to be the typical way that things go. Even within states who had different fatality review panels for different districts of their state, their panels did case selection differently. And so it really seems to be whatever fits for your jurisdiction or your state, whatever's best practice seems to be what folks are going with. And we found that to be standard through our national technical assistance provider. Didn't say this is the best practice, right? It really seems to be determined state by state and panel by panel. Also, for folks, we have newly created a parent voice subcommittee. That subcommittee will be looking at what are some of the options that exist and ways that we may think about incorporating parent voice into the work of the panel, and how do we do that thoughtfully. So they are going to be sort of endeavoring in a similar path of what we did with this case selection process. They'll be reaching out to national technical assistance providers, doing a national look, connecting with other panels to see how they incorporate that type of feedback, and also talking to our community partners within the state to determine what are some ways that we might be able to do that. These subcommittee members will bring their observations and the information they find back to the panel, and we will then have a conversation about, are we going to do this? How are we going to do this? And start formalizing some of those processes. And that will be a panel decision when that time comes. There's no timeline attached to that work. I think folks can deeply appreciate that some of these additional tasks that panels undertake can sometimes take a longer amount of time or shorter amount of time than we think that they should or will or would. And so I will keep you updated on the work of that panel, but we don't have any sort of firm thought at this point of when we will make a decision on how we're going to incorporate or if we're going to incorporate parent voice. We are continuing our deep recommendations review for recommendations that the panel has put out over the last 15 years. There's no, we're sort of really digging into that work now. So there are no sort of high level observations, but as those come up, we will chat with you folks about that. We did spend some time at our October meeting doing our December meeting doing a little bit of a deeper dive into the past recommendations and spending some time within our panel meeting to do that work. And so we'll be looking forward to sharing that insight in our 2026 report, which is next year's report. We'll really focus on the work that we're doing there. We anticipate that our 2025 annual report will come out in time in March. This report that we're releasing in March this year will cover July 1st of 2024 through June 30th of 2025. Some of you might know we changed our reporting schedule a few years ago, so we're sort of in that period still where we're catching up on some odd timeframes for reporting, but that will be coming out in March. And then lastly, I know Ms. Hova mentioned that CDCERP attended the Justice for Children Task Force meeting in December, where we provided a quarterly update to that task force about the work that we've been engaged in, which is much of the same information as what I'm sharing with you today. Any questions before I jump into case review information? Absolutely.
Representative Graham?
Thank you, Madam Chair. I think I probably was the one that asked you about the question about
Great.
how we look at,
Yeah.
and I would really like, really to say on Mike that, reading this, Maine is among the lowest per capita for child deaths. In 2023, Maine had 15 child deaths per 100,000 children. And not to, any death is tragic, any, so I'm not trying to say, but I think that in our small 1.4 million people, that's very difficult for us. But I also, looking at how, where other states are at and kind of putting things in perspective that indeed, it's the tragedies we've had are, we don't want to happen. They're horrible, but they're also not extreme.
Right.
Can you talk a little more about, I mean, and again, and the kids count, the Casey Foundation does such amazing work to help us put it on perspective. Can you talk just a little more about that?
I think what I would possibly add to sort of that 15 and 100,000 is that accounted as well for sort of accidental death.
Yes.
Right. It's not necessarily what we think of as, I'm not saying it's not traumatic and it's not tragic, but it's not the
Yes.
sort of traumatic intentional harming of children. And so it is, I think it does provide a much broader perspective of what we're talking about and providing context. And I actually have brought you some numbers to sort of continue to do that around what case review has looked like as well. Because one of the key pieces of feedback that I received from Mark Moran after the last update is he said, you use the term several child deaths, and that's alarming, right? Because out of context, it can be very much like, well, what does several child deaths mean? And should we be alarmed by that number? And so I think sort of providing this larger context around what kind of numbers are we talking about can be really helpful in sort of thinking through what is the scope of the problem that we're looking at. And so I don't know as I can give you like much more about the Casey Foundation or the kids count statistics, but it really is a phenomenal resource for folks that want to unpack that a bit.
No, I thank you. I mean, I think that having perspective is extremely important. Being a retired pediatric nurse practitioner, I'm looking down towards the stuff when we talk about no longer called failure to thrive, but now failure to thrive is now something different. But my point being is there are so many complex issues around the loss of a child.
Sure.
And so thank you for putting it in perspective.
Absolutely. Great. I also want to acknowledge that I think I sit in a particularly difficult place around being really respectful of providing information about tragedies that have happened in a numerical way. And I just want to say that I know that this is a very emotional topic. We all feel very passionately about child safety and family well-being. And so want to name that sort of the basic nature in which we talk about this in numbers can feel not great. And I want to acknowledge that.
And we are very grateful for that acknowledgement. The quantifying of the tragedy that is the loss of a child absolutely needs to be wrapped in respect and sensitivity.
Absolutely.
We here in this committee have on far too many occasions been confronted with the quantifying of the death of children that is at best misinformation and is very painful for those parents who have lost children to have those numbers in some cases politicized. For those parents who have tragically lost a child through an accident to be incorporated into a quantification of child deaths, along with the abhorrent abuse and death of children at the hands of their parents or caregivers. Very, very painful. And it has been perpetuated year after year since I have sat behind this worship. So I deeply appreciate that you are parsing out here and using respectful delineation of what we are talking about here.
So thank you very much for that. I also wanted to remind folks that the case reviews that the Child Death and Serious Injury Review Panel engages in are confidential. And so what I will provide to you is sort of general information and observations without specifics around families or circumstances. So for level 1 reviews, and level 1s are the most surface level review of all cases where we look at very basic facts. We were able to do level 1 reviews on all of the child deaths in our state. And we were able to do from September and November of 2025. That was the child deaths. And we also reviewed all of September and some of October serious injury. Anytime we come back, when we come back in the fall, we always have sort of that backlog of reviews that happens over the summer, which we try to catch up on in September. And then we sort of, we always have this period of time where we're playing catch up on reviewing cases. As I had said at the beginning, we had our January meeting already. We've caught up quite a bit more in January and have a plan for February to completely sort of clear the backlog of reviews that need to happen. So I will say that. For these level 1 reviews, this includes 4 child deaths and 25 serious injuries. So that's the scope of the cases that we're talking about for this period. In October, we did a level 2 review. For folks might remember that level 2 reviews are where we have identified a theme in cases and we explore that theme and sometimes have panel presentations to inform our work. In this level 2 review that we did, it was growth faltering, which has historically been referred to as failure to thrive. Dr. Miles presented information about failure to thrive to the panel before we engaged in the case review. He provided information about how growth faltering cases are identified, how they're evaluated, diagnosed, and managed in the long term. This is where Dr. Miles was particularly sad to not be here because he wanted to give you all his spiel about growth faltering. I think he and his colleagues down there at Spurwink are also single-handedly spreading the, please call it growth faltering and not failure to thrive missive throughout our state. And so, in any way that you have curiosity around that, I would connect with Dr. Miles. Two of the cases, there were 3 cases in this thematic review that we did. 2 of the cases involved children under 1 year old. In both those situations, additional caregiver support and resources for the family, for the children, resulted in weight gain. OCFS closed both of those investigations without findings. And the third case we reviewed was an adolescent. The case was still pending with OCFS when we discussed it. And in this case, the family reported that there was not enough food in the home, particularly food that the adolescent wanted to eat. And there was some deep work happening with community resources to support that family at the time of the review. One of the panel's observations about that adolescent is that they had multiple diagnoses that made it really difficult to address growth faltering without addressing the other components of that child had, the medical concerns and the like. Some of the observations that we made from this discussion about growth faltering, which some of this may not surprise folks, is that we viewed evidence of judgment being passed on to caregivers in growth faltering cases. And we observed a pretty significant impact that judgment and bias can have on medical professionals' determination to make reports to mandatory reports to OCFS. We also observed that a specific impacts on if even making a specific diagnosis of growth faltering is made, and the negative impact that that has on the relationships of families and caregivers. It was really clear in several of these instances the bias that a lot of these caregivers had toward the families where they were making these diagnoses. We also observed opportunities to provide referrals and community connections to community support services in conjunction with reports to OCFS. I think these are consistent with some of the other observations you've heard from folks today around how do we get support to families who are maybe experiencing some risk, but there's sort of absent of this unsafe condition that families are living in. We also generally acknowledge that families often have both medical and social components as factors in their lives. Both matter, and interventions in both need to be explored. In the 3 investigations that we reviewed, there was a pretty significant disconnect between the aspects of the family's life and the medical interventions that were being implemented. Families involved in these cases expressed a lot of frustration about being proposed different plans from different providers. One example I will give to you is that one of these families, the mother had some pretty significant postpartum depression and was really being shamed by some providers around her inability to breastfeed, while other providers were saying you shouldn't even bother breastfeeding and should just supplement formula, which was not what that parent wanted to do. And so there was a lot of disconnect and distrust between that parent struggling to feed their child and that family's journey to try to adequately feed their child, and sort of the information that they were getting from their medical providers and how they felt about how reliable that information was from medical providers and what the best thing actually was to do. So that was one example that I can provide. We also noted that in all 3 of these cases, the families were in pretty traditionally under-resourced areas of our state, which is also probably not surprising for folks. Some of the follow-up, and this is a potential recommendation that came out of this review, would be that the panel would recommend providing outreach and education to medical providers about the Spurwink Center for Safe and Healthy Families, Thrive Clinic, and the services they offer. A lot of these conversations around a diagnosis around growth faltering would potentially benefit from having more of an in-depth look at them. Also utilizing public health nursing to support families with children under 3, and exploring a collaboration with the CDC, which has received funding to expand Maine's doula network and perinatal support services. I also want to note that the panel identified 5 more cases of growth faltering in our January meeting. So there were 5 additional cases where medical professionals had said there was some sort of issue with the growth of children that we will be adding to this thematic, this review of these types of cases. So any additional observations will be brought through to here. That's my update for you all this quarter.
Question from Representative Graham.
Thank you. Thank you again, Madam Chair. I appreciate it. Looking back longitudinally around growth faltering, are we seeing an uptick?
I mean, I would say based on the case reviews that we've had, we have seen an uptick. And I think one of the things the panels, particularly after this last round of having 5 cases come through, is it one specific area, is it one specific provider or group of providers that is making more diagnoses, or is it more of a statewide?
And are you seeing it?
We don't know. I
You
think
don't know
that'll
yet.
be something that will be sort of
The ones that
examining.
are coming in January.
Yeah.
Yeah. I mean, when we look at the socioeconomic issues and the things that we're facing,
Yeah.
particularly in this last year, that would be interesting. I'd love to see what's transpired in the past. And then we've changed the diagnosis to a certain degree as well. So that might kind of muddy it, but thank you.
Another observation that some of the panelists made is that some of these diagnoses seem to be happening at a very early stage, and that children are often lose weight after birth, directly after birth. And a lot of, I think that's going to be also an area of an examination to say, is that diagnosis being made too soon for children who are just lower, they have a lower weight than their birth weight, but they're 4 days old, which is somewhat expected.
Go ahead, Senator.
And that brings up a good question, because I heard failure to thrive was the new term I had not ever learned until I had a constituent reach out to me. Is there any conversation about maybe working with some of the providers to make sure that they're definite? Because in this case, the baby was premature and was really thriving, but yet at a below level of what charts say that they should be.
Yeah.
And, and so there was a community that was all concerned because they felt like the baby was doing great, but yet the doctor said no.
Right.
Yeah, that. So I guess, is there any kind of conversation going on with the
Yes.
providers?
Yes, I think that's one of the things that the Spurwink Center is doing a lot of work around, and is something that is I think that we can say that from the amount of diagnoses we've seen and how we're seeing that sort of bear out in our case reviews, it gives us something really tangible to go to providers and say, this is sort of what we've been seeing as a trend, and this is perhaps how we can support better evaluation and diagnoses. And that would be the job of, we have a lot of medical folks on the panel, and certainly the folks from Spurwink who are doing that pediatric child abuse work to sort of help make that delineation for some of those providers around
And maybe the
concerns.
changed.
Mhm. There, in one of the cases, there was sort of an acknowledgement by providers that the kid was just really small.
Mhm.
Like the family was they were small in stature. The child was born small. The child was not growing at a exponentially quick rate, but was growing. And so sort of taking in some of those additional components, even though providers it may not have been what providers wanted to see, sort of examining the entire context of that situation. Absolutely.
Thank you.
Are we also seeing in those case reviews that once, along with ensuring that we've got some education toward the diagnosis and the diagnostic criteria, are we also seeing that when issues around, say, breastfeeding, are there recommendations or referrals to, say, lactation consultants? When food insecurity or a lack of nutritious food in the household is an issue, are we seeing that providers are able to make the connection between programs that may be able to, or services or community resources that may be able to connect that family with food resources?
I certainly think not necessarily in these case reviews, but sort of the topic of like having a more interconnected response
Yeah.
of is certainly a topic of conversation. And I could imagine we're going to have a more robust set of recommendations around growth faltering. And I think all of the things that you named are things that the panel has discussed and maybe part of a larger package of recommendations.
Okay.
For sure.
Any other questions from the committee? Seeing none.
Okay.
Thank
Thank
you.
you all so much.
Thank you. Should we go to Zoom? Does the committee need 5 minutes? Okay, we're going to take a 5-minute break. So we'll be back. Okay, welcome back after a brief reprieve. And we would welcome Amin Cabral from the Maine Child Welfare Advisory Panel on Zoom with us today.
Good morning. Thank you, everyone. I just want to make sure you're able to see my screen with the PowerPoint.
We absolutely can see it. Welcome.
Wonderful. Thank you so much. Good morning, Representative Myers and esteemed members of the Health and Human Services Committee. My name is Amin Cabral, and I'm one of the co-chairs of the Maine Child Welfare Advisory Panel. My other co-chair, Andrea Mancuso, is unable to be here. I know that she joins you all for other updates, but I'm here today to present the quarterly report from the Maine Child Welfare Advisory Panel. My presentation today will focus on the last quarter of activities of the panel through December 2025, as well as provide an update on the MCWAP annual report. Before I jump into our updates, I just want to give an overview of the panel. The Maine Child Welfare Advisory Panel, also referred as MCWAP, is one of Maine's 3 citizen review panels for child welfare. The citizen review panels are child welfare advisory oversight entities that are federally mandated under the Child Abuse Prevention and Treatment Act, CAPTA, and the Children's Justice Act, CJA. These panels are professionals and private citizens that are responsible for determining whether state and local agencies are effectively discharging child protective and child welfare responsibilities and making recommendations for system improvement. In Maine, you've heard from the other 2 citizen review panels, the Justice for Children's Task Force and the Child Death and Serious Injury Review Panel. Each of the 3 citizen review panels has a different focus, and MCWAP is really charged with meeting federal mandates both under CAPTA and CJA. It reviews functions and practices of child welfare system in the broadest terms, and MCWAP receives input from citizens about the systems. The MCWAP members are professionals and private citizens who have expertise in prevention and treatment of child abuse and neglect, or direct personal experience with the child welfare system. The system works to maintain a broad and diverse representation, including but not limited to foster, adoptive, and kinship parents, domestic violence professionals, mental health professionals, courts, court-appointed special advocates, guardian ad litems, and many other specialists who bring diverse expertise. As I mentioned, MCWAP issues the annual report at the end of each January, and usually that contains a summary of activities for the last year, as well as historically we provide recommendations that have been reviewed and voted on by the full panel. Our recommendations typically include both ideas and recommendations for future work that the panel will focus on, as well as external recommendations for the child welfare system, the courts, and other policymakers. This year, MCWAP we're currently working on our 2020 annual report, which we'll have by the end of January. However, instead of creating new recommendations, the panel's been spending a lot of time in gathering updates and statuses on our past recommendations. So this report will have those updates for you. And again, we'll have that to you by the end of the month. And then I would also note, the panel is definitely in a period of transition. We've had a number of long-standing members who have
Really?
Attention, there has been a fire alarm activation at this location. Please evacuate the building in an orderly fashion while the source is investigated.
I'm assuming you can hear that.
Yes, I can.
Okay, we'll be back.
We'll take care.
Hopefully.
To evacuate, please execute your evacuation plan.
Thank you. Ready, folks? Welcome back and thank you for your patience. We had a fire alarm here in the building and we are now back assembled behind the horseshoe. Unfortunately, Amin Cabral from the Maine Child Welfare Advisory Panel had another obligation. If we do have her presentation and if the committee has any questions, I'm sure we can send outreach to her for answers. We'll also get a report back from her on what her presentation, perhaps her presentation itself. With that, we would welcome our Child Welfare Ombudsman, Christine Alberry.
Thank you. Good afternoon, I think now, Representative Meyer.
It is.
And members of the Health and Human Services Committee. Thank you for having me here today. My name is Christine Alberry, and I am the Child Welfare Ombudsman for Maine. I'm here today to present the 2025 Child Welfare Ombudsman's Annual Report. I'm pleased to report that for the first time since 2020, this year's case-specific reviews indicate that the department has halted a years-long decline in practice and instead has shown practice improvement. As with any complex system, progress is incremental and will not occur quickly, but this year's results indicate positive change. The Ombudsman's Office categorizes cases The Ombudsman's Office categorizes case-specific reviews with serious practice problems as having substantial issues. In 2021, cases with substantial issues equaled those without, and from 2022 on, cases with substantial issues outnumbered those without. This year, fewer than 50% of cases had substantial issues. I'm also very happy to report that the department and the Ombudsman have continued to build on a vastly improved collaborative relationship. Unfortunately, child welfare staff are still struggling with complex cases and under-resourced services, as well as gaps in training and caseworker turnover. As I have said to you before, a robust system of service providers, attorneys, transportation for parents, experts to consult during both investigation and reunification cases, and a fully resourced court system are all important to support the best casework practice possible. Services are key during child welfare involvements, but even more important are prevention services and financial support for families to prevent calls to child welfare in the first place. Most necessary services exist in Maine in one form or another, but there are gaps and needs that, if addressed, could help prevent children from being abused and neglected. And I didn't write this here, but I just want to take a moment to remind everyone listening that my office, we are charged with, investigating complaints against child welfare services. The line that you saw in the first presentation of risk, community services over here, child welfare services over here, we are focused on child welfare services. That doesn't mean that those other services aren't more important or as important as child welfare services. This year's annual survey of our case-specific reviews found that the department still continues to struggle with practice during initial investigations and during ongoing assessment of the reunification of families after children enter state custody. And that's has been true for many years in our reports. However, I wanted to take a moment to discuss this year's findings about educational neglect. The department, both currently and historically, has struggled to respond effectively to allegations of truancy and educational neglect. There is and has been considerable institutional resistance to having child welfare involved in reports of truancy and educational neglect, though the statute clearly indicates that this is child welfare's responsibility. Starting on page 11 of this year's report, we have laid out the statutory and policy and practice framework currently in place, and I'm happy to answer any questions about that. At this time, the department will only investigate a report of truancy as possible educational neglect if it is reported by a school. The truancy must also be as a result of parental neglect. If the school does not know why the student is not at school or does not report that the truancy is as a result of neglect, the report will be screened out and not investigated. If the truancy is reported by someone other than school, such as a neighbor or relative or law enforcement, the report will not be screened in for investigation unless there are other allegations of abuse or neglect. If a report is screened in for the department to investigate educational neglect, or educational neglect is discovered during an investigation, the issue is often not flagged as the serious risk factor that it is. Families can struggle for a number of reasons to get children to school, and services to help are often in short supply. However, in multiple case-specific reviews this year, extreme cases of truancy were not investigated thoroughly, or findings were not made, and follow-up to address the truancy was not completed. The cases reviewed this year, some of which are summarized in the report, are cases where children have long-term school attendance issues, including chronic tardiness, that the parents are unwilling or unable to address because the absences are as a direct result of serious abuse or neglect. The educational neglect is as a result of parental substance use, mental health issues, domestic violence, and/or criminal activity. In the worst cases, the parents keep children home from school or withdraw children from school to hide bruises or because the child told school staff about abuse or neglect in the home. If you read the summaries beginning on page 12, you will see that these are cases where children are absent and unexcused from school for extended periods of time. 60 days, 67 days, many years of absences, culminating in parents pulling children from school entirely. And I just want to say, because I know that there is a history of concern among homeschool parents of child welfare interfering in their ability to homeschool, this is not what we're talking about here. We're talking specifically about cases where young children, usually elementary school age, are not attending school for weeks and months because something is happening in the home that is not good, or parents who have not registered their kids for homeschooling. And generally in these cases, it seems to be a huge risk factor for other things happening in the home that put the kids in danger. I'm just going to read you one example because I think it illustrates both the short and long-term impacts of this and what can really be going on in some of these cases. In this one case, reports of truancy in 2023 and 2024 were screened out. And then another report was made that a child had 57 unexcused absences by March of 2024. The child remained in the parent's custody, and at the end of the investigation, when the child's absences had reached 70, the department made substantiated findings of neglect for truancy. No child protection petition was filed and a service case opened. The children remained in the parent's custody for 4 months. The investigation was opened initially due to a report from a relative who had seen drug paraphernalia in the home within reach of the children, and the children had actually brought the relative pieces of crack cocaine. During the first days of the investigation, the parents were not asked to drug screen or sign releases. During the service case, the child reported wanting to go to school, but could not wake the parent up in the morning. The child was given Benadryl at night to sleep. The other parent was arrested for furnishing crack cocaine and fentanyl at the beginning of the investigation. That parent also later admitted to using crack cocaine on and off for the month of May of 2024 during the investigation and case. In June 2024, a report was received of drug dealing in the home with multiple people in and out and hypodermic needles found in the yard. The children came knocking at the neighbors' doors because they were hungry or felt unsafe. The children eventually entered custody after the parent went to detox, but then immediately returned home. After entering custody, the child disclosed physical abuse by both parents. So again, these are cases where these are not instances where a family is having a temporary struggle with transportation or something else is going on that, you know, they need some help with. These are cases where truancy, educational neglect, they mean slightly different things, are sort of indicators that there's other forms of serious child abuse and neglect going on in the home. And we found there were many cases this year, an outsized number, I would say, given the number of reviews that we did. But this has been, I think, something that our office has struggled with for years. And even my predecessor, I know, had many conversations with the department about this and what the department's role was. I mean, we made some pretty specific recommendations in this report about it doesn't even necessarily require a statute change, but just about policy and practice and how the cases are investigated and how chronic absenteeism of children is viewed within just a regular child protective investigation. Finally, I always like to end with a positive. I write positives in all of my reports. And this case in particular, I think it was my favorite positive finding of the year because so often we hear that teenagers can't be helped, child welfare can't help them, there's nowhere to put them, they're going to struggle behaviorally, they're going to run away. This is an instance where the caseworker just kept going and made an enormously positive impact on this particular child's life. So what I wrote in the report was, and I know it's not a lot of detail, but the permanency caseworker consistently supported a teenager who had entered custody, and after placement disruption, hospitalization, and running away, kept close contact with the child, providers, foster parents, and the caseworker gained the child's trust. The child was able to finally stabilize in a new placement after months and started to engage in treatment. Thank you for having me here today, and I'm happy to answer any questions that you have about anything in the report or anything else.
Thank you, Christine. Questions from the committee? Representative Zager.
Thanks, Madam Chair. Thank you again. Are there a lot of times where there's educational neglect that is not compounded by other things? The example that you gave, for instance, seems really extreme and awful. There were also, active drug use and and physical abuse and et cetera that would, absent the educational neglect, would also warrant child welfare being involved. So is it ever isolated?
So I haven't seen a lot of that, but it may also be because those were not cases that were necessarily opened by us, or I think that there's definitely a distinction between, like I said, say a family. And just to clarify, so the department is only right now responsible for investigating cases of truancy, which is defined under the education portion of the statute, if the children have not yet completed 6th grade and are either 6 or are already enrolled in kindergarten, even at age 5, and then stop going. So there's a very specific window, basically elementary school, where the department is required to investigate under the statute, or it could be considered abuse or neglect, or I guess it's just neglect under the statute. So there are definitely instances where this type of situation in that one case summary certainly do not exist in the home. For example, a child might, let's say a child was very ill and the school was giving the parent a hard time about getting doctor's notes. Parent couldn't afford to take the child to the doctor for some reason. It eventually gets resolved because the child is better. Maybe the school shouldn't have interpreted it the way they did in that particular instance. But it's sort of a time-limited specific example that doesn't have to do with child abuse or neglect, more has to do with difficult family circumstances, maybe related to poverty or lack of health care or something like that. Those are not cases that the department generally will investigate, and nor do I think they should. So there's an example of a case where, say, a child was, missed 15 days of school unexcused because the school didn't believe them and they didn't get a doctor's note or something like that. That's not a case related to child abuse or neglect. There are also instances where parents are struggling to obtain services for the child through the school. Say that the child has an IEP that's not meeting their needs, or the IEP that exists isn't being fulfilled. So the child doesn't have a one-on-one for some reason. So the parent keeps the child home because the child's not able to function in school, but the school wants the child there. Those types of disputes are not what we're talking about here. And I sound like I'm not meaning to pick on the schools here, but these are sort of common situations that occur that they fall outside of what I would expect child welfare to help with or investigate. And I think that those cases generally aren't being opened for investigation, or at least not that I've seen or heard about. Does that answer your question?
I think so. It might be a more complex question than we can get in at the moment. Yeah, but maybe we could connect.
Yes,
Thank you.
anytime.
Yes, Representative.
Thank you. 36 out of 76 is still a 47% failure rate, which is pretty high. So how do we get this down to 2 or 3%?
That's a great question. So I think part of what I'm pleased with, you're correct. It's still not what we would like to see. And I know it's not what the department would like to see either. I think by continuing to do some of the things that the department has been doing to improve practice, so child welfare practice, you know, and just to be clear, I'm not exactly sure which things have been more helpful and which things have been less helpful. That's something I think, you know, maybe for Director Johnson or somebody else to answer. I do know that there are some districts that have been doing really excellent work with training and mentoring. The department has hired supervising trainers for all of the districts. So those are the things that I think are really helpful. There are other things too, the safety science, helping identify issues. Each individual district seems to be working on different things. I know intake is working on some things, you know, running mock cases to try to make sure that everyone is doing the practice the same way and the correct way. How to continue to bring this down, all of these things need to continue to happen, but more clearly also needs to be done. And I think right now what I'm seeing is a more of an uneven progress throughout the state. Some districts are doing better than others, and I don't want to get into who because I don't think that's productive, but sometimes there are staffing issues. Sometimes it's hard in districts where there are just no resources at all whatsoever to help support child welfare. I think as I, continue to repeat, I think that the services that allow caseworkers to learn how to do their jobs and the supports that allow caseworkers to learn how to do their jobs are really important. So again, for example, if there aren't enough visit supervisors to provide those services, then the case aides end up doing the supervised visits or helping with those. Then the case aides aren't doing the things that they're supposed to be doing to assist the caseworkers. So then the caseworkers end up being swamped and can't do their jobs correctly. Or they leave because they're frustrated and feel overwhelmed. So I wish I had a simple answer for you, but I think that the department should continue to do the things that they're doing that are working, because there has been a difference this year. And some of it, I think, is the willingness to embrace, and acknowledge the problems that exist, as well as the things that are going well, and figure out what is working and what is not working. I think, and this is slightly off topic, but I think that part of the reason that we as an organization felt able to have this whole separate section on educational neglect this year, this is not a new issue in particular, but because I think we felt like the department was hearing our concerns about basic investigation practices in a way for the last couple of years that they hadn't before, and reunification services. But I agree, it's still not, these are children. So ideally, every single case would be handled perfectly and every single investigation would be perfect. I don't know what that percentage would look like in terms of practical reality, what a really high functioning child welfare department would look like. But I do think that we're headed there. Maybe we could go faster. I don't know, because again, I'm not exactly sure what particular things are working the best.
One last thing.
Sure.
I know you can only guess, I doubt you have the numbers, but what do you think is the percentage of the 36 that are in areas that don't have the services that you were talking about, don't have the staffing, compared to those that do? Do you know what that percentage is?
I would have to find it out, but I can't give you the exact percentage, but there are districts where the success rate is much higher than this, and there are districts where the success rate is much lower. And generally it does seem to be related to staffing and services, at least. And again, that is the correlation that we're seeing. Whether that is the whole story, I don't know.
Could you get us those numbers?
I can try. I can try again.
Anything close?
I'll try to work something up with the cases we have.
Thank you.
Senator.
I guess I'm going to ask the elephant in the room question. You know, we've been looking at LD 555, you know, that talks about a separate department.
Oh, yes.
In your opinion, do you think moving child welfare services out of DHHS would solve some of the problems that we're seeing? Or are we on the path to make those changes without having to disrupt the department?
I would be concerned about disrupting the department right now. I think that there's a lot of good that could come of, I mean, whether you move it out of DHHS or not, having the consolidation of child welfare or child-related services, even juvenile justice, children's behavioral health, child welfare, and I'm sure I'm missing some, but you know, the big services that deal with complicated issues all being in the same place. But I think I do worry right now that if we did that, some of this progress that we're seeing would be derailed. Again, I don't know for sure, but
And I appreciate your. Thank you.
Seeing no other questions. Thank you.
thank you.
As always.
What was that?
Okay. Welcome, Director Johnson.
Thank you.
Your feet warm up.
Yes, I recovered from that. It was a nice little breath of fresh air.
Yes.
So good afternoon, Representative Meyer, and members of the Health and Human Services Committee. My name is Bobby Johnson. I'm the Director for the Office of Child and Family Services, and it's my pleasure to be here today to present the quarterly child welfare update. Olivia is going to bring the slide back up once she is so the agenda for my presentation is to talk about the OCFS strategic plan, and I have structured this presentation to really align with the different components of the plan to provide an update in that way. So maximizing safety, achieving permanency, increasing well-being, navigating policy, and engaging our workforce are the 5 big buckets that the child welfare plan is structured around. I'll also provide some additional OCFS updates and then a couple of federal updates that I think the committee might be interested in. So under maximizing safety, and some of this other presenters have already spoken about. So the first one was strengthening mandated reporting. And Melissa Hackett spoke a lot about the work that we're doing as a committee. There is a LD 2105 that we worked on collectively in order to update the statute. We have a work group that's been having regular meetings. We did a lot of research with mandated reporters, surveys, focus groups to understand their needs and things that would improve mandated reporting in our state for them. Updating our training curriculum. And I think as was mentioned, looking at, we'll have, you know, the basic training that will be required for all mandated reporters. And then part 2 is looking at how we are going to build out curriculum specific content for law enforcement, for medical providers, for educational staff in order to really address their specific questions and needs around mandated reporting. And then just providing additional guidance for mandated reporters. We've also been, and I think the Child Welfare Ombudsman mentioned this, improving quality and consistency in our intake reports. And so we've been doing live call quality assessments. So people are actually listening to the calls that our intake workers are receiving to make sure that they are getting the information that they need, that they're asking the questions in order to gather that information is then being documented using the tools. And so that's a quality assurance and training opportunity for those staff to see if there's any gaps and then improve their skills. We also have quality assurance reviews of the reports that are happening. So when the reports are written, we're taking a subset of those and having staff that are looking at those through that quality assurance lens. And then lastly, doing some inter-rater reliability testing, which is a standard part of our structured decision-making tools where you have a group of staff that have the same report. They use the tool and the goal is that they would come out with the same decision at the end of using that tool. And so, so those are some of the ways we're trying to get at the quality assurance around improving the work that's happening at intake. The other thing that we have recently launched, and I'm excited to share, is around strengthening family team meeting practice. And so we have just identified 8 family team meeting facilitators. So those are staff that will actually, that's their job, is to facilitate family team meetings for our staff. We've had these positions before with some really good success. They will help convene the teams. They will help guide them through an agenda that explores, what are the needs that this family has? What are some solutions? What would it take to keep the family intact? And then what's the plan going to be at the end of that meeting? We are focused on pre-removal family team meetings. So prior to removal, having these staff help facilitate those meetings with parents, youth, their team, providers, in order to look at how we can prevent removal if that's at all possible.
Are they located in each district or?
Correct. We have one assigned to each district office.
Excellent. Thank you.
Yes. We also have been conducting focus groups with our own caseworkers and then with other partners. So parents with lived experience, resource parents, attorneys, youth, and other service and community providers to understand what their experience has been with family team meetings and how we can improve it from all those different perspectives. And a question that we are embedding within OCFS, really launching 2026, is what would it take? So what would it take for this child to not have to be removed? What would it take for this child to be reunified? What would it take for this child to be placed with their siblings? What would it take is really how we are helping our staff to be able to think from a solution-focused perspective, to think outside the box. Before I came to this meeting, I had the chance to meet with our district leadership team, so our program administrators and assistant program administrators, and one shared that their facilitator had a meeting this week. They brought together the parents, the youth, relatives, and some providers. It was a child who has some multi-system involvement, some juvenile justice involvement, and they were surprised at the outcome. The outcome was not what they expected. It was, the child's going to go and be with the grandparent, and mom's going to be a support to the grandparent. But this was a family that was prepared to come in really defensive, as we anticipate sometimes with our involvement. And it really was a process that this facilitator was able to guide them through what will it take and what's in the best interest of this young person. And the young person was part of that meeting. So that's what we always hope for, is that their voices are present and they can help define what's going to be success for them.
Can I ask, Director Johnson, was this the first experience with a family team meeting that this particular family unit had had?
I believe so, but I don't know the answer to that. It was the first one that this facilitator
Right, so the first
had done in this
facilitated,
role.
right.
Yes. Yeah,
Right.
it was the first one that had been facilitated in that district office. So they were
It
excited.
would be
to
interesting to
share.
know families who have experienced team meetings before, whether, what their opinion is of, a trained facilitator in these.
Absolutely. And we're looking at ways that we can measure the experience for the participants.
great.
So having a survey or something that they can complete just to give us feedback on, were they engaged? Did they feel engaged in the process? Were they part of making decisions? Those types of things that are really important as we're working with families.
And you mentioned that these were pre-removal team meetings with the facilitators. I would assume the plan is to go to facilitating those cases where a child has been removed. And then is there a plan for a post-reunification team meeting? Does that exist? Do
So we have- circle
back to that?
So so the family will have team meetings all along the
Yep.
case continuum. Whether they'll be facilitated or not, it'll be a capacity issue, really. So we've prioritized ones prior to removal so that we can be really intentional about trying to prevent removal whenever that's possible. Also ones where we're developing plans for the family. So, and then, any other challenging or difficult cases, that it would help to have a neutral person facilitating the process and helping to guide the development of a plan for a child or a family.
Okay. Did you have a question, Senator?
No.
No. You had that question look on your face. Thank you.
Thank you. So on the next slide, right-sizing the number of children in foster care has been a focus of mine since I was appointed to the role of director, and in the department has been a focus. There's been the focus on preventing child abuse and neglect and, really moving upstream with our efforts. And that was a lot of that work was presented this morning by Mariette and by Melissa. It's important to understand that the number of children in care is a function of both children entering care as well as children exiting care. And Maine has been cited as a state that experienced an increase in the number of children entering care for several years, while other states were experiencing a decrease. The number of children in care, the increase in the number of children in care that we saw really corresponds with child deaths that had happened in our state. And that's not unusual. I know I've spoken to this committee about that before. It's a common thing that is seen in jurisdictions across the country, that when there is a or multiple child fatalities that occur, they see increased reporting to the Child Protective Intake Hotline, a system that really moves to being risk aversive and wanting, as we all do, to protect all of our children in our state. And so our increase really corresponds with that. More recently, Maine has seen a reversal in this trend, and that's what this chart is reflecting. Through careful analysis and utilizing a safety science framework, the following factors were identified as contributing to this increase. So increased reporting to the Child Protective Hotline, substance use, mental health, and behavioral health issues for parents and children, a lack of services for children and families, court backlogs, shortages of attorneys, and we're beginning to see positive movement in a lot of these different areas. The department is committed to, whenever possible, not removing a child from their parents and helping them to be maintained in the home. One of the things I've talked to my staff a lot about is one of the reasons it's important that we're connected to the prevention and the upstream work that's happening in our state is because that's the infrastructure we need in order to prevent the downstream involvement with the child protective system. And so it's really important that we are a partner in that work. And, our district leaders are connected to the community collaboratives and the resource hubs that have been spoken about earlier today. Since July 2024, so in the last 18 months, we've reduced the number of kids in care by 23%, and that has been through reunification, adoption, and then we've had a small number of youth that have aged out of care. In September of 2024, we had 2,441 kids in care, and in December, we had 1,878 kids in care. So that's 458 fewer children in care. One of the things you will notice if you look at our data dashboard is that we've updated it. Prior, it included, those numbers also included the number of youth 18 to 23 that were on a voluntary extended care agreement. And we have pulled those out from that data set. We report them separately. So right now we have 138 youth across the state who are between the ages of 18 and 23 that we continue to support in young adulthood. Under achieving permanency, so we have a process by which we routinely review the circumstances of children in care to address barriers preventing them from achieving permanency. And that is our permanency review team process. Casey, over the fall and winter, conducted focus groups with staff to inform recommendations on how to improve this process. And so that's one of the things that we've been working on. We also are committed to kin first placements. So in our system, we have been focused on kinship placements, but now we're looking at kin first placements. So if we can't prevent removal and a child can't remain in with their family, is there a relative that they can be placed with? And if they have to come into custody, can we make sure that that first placement for them is with kin? There's lots of data across the country that shows when a child is placed with kin, there's more stability, there's more longevity in those placements.
Maine is part of a New England collaborative that's kicking off in February related to kin first placements. So it's all of the 6 New England states coming together. The states have different percentages of children placed in kinship care. And so we're going to have the chance to learn from each other, to understand the different factors that impact placement with kin. And then also this work is supported by Casey Family Programs. The other thing that we're working on is adopting the federal standards for licensing kinship homes. So there is recommendations from the federal government that are not on the safety related items, but when a family goes through the licensing process, that there are certain expectations. So I'll give an example. There's a certain size that a bedroom has to be, and a certain number of youth that can be in a bedroom. And somebody might argue that if grandma's willing to take the kids and she says, I'm going to sleep on the couch and I'm going to give up my bedroom to the children, that is okay for that to happen. Now, under traditional licensing standards, that would not be appropriate. But in the kin licensing standards, those are flexibilities that states can make. And so we're really looking at, again, going back to that question, what would it take? What will it take for this child to remain with their relatives who they know and are committed to their success? We've also been looking at other barriers to permanency and addressing those. So having contingency funds available when children are going into child home placement with their parents. So some examples of the use of these funds have included housing. So we've helped families with their first and last and month's rent and security deposits, heating, fuel, pest control, utilities, trash removal, appliances, home safety equipment, safe sleep accommodation. So it's really, a lot of it is related to those poverty related issues that families may be struggling with and how we can help support them to address those. Also looking at services for children and families. And one of the things that the department is engaged in is an operational excellence process with our OpEx team, looking at children with complex needs. And so this involves OCFS, so Child Protective Services, the Office of Behavioral Health and Children's Behavioral Health, CDC, and MaineCare. And so we have been working with the Operational Excellence team to have a no wrong door approach. So when these children are identified, they may need services from some of these different systems. And how do we have a no wrong door approach and a team that comes together to talk about the needs and the services that the department provides, which sometimes across offices, we're not aware of what those resources are. And so this is a way to strengthen that cross-office knowledge, to strengthen the support that we're providing to these children and their families. So that's one of the ways that we've been doing some of the work to address barriers. We also hired RLS Associates to assist us improving transportation services for child welfare involved families across the state, and especially in rural and underserved areas. As part of this effort, we are conducting focus groups with our staff that are responsible for managing either providing transportation or coordinating transportation. And so that will all be part of the evaluation that's done by RLS Associates to help us understand how we can improve transportation services, the structure of our transportation services for child welfare involved families across the state. And then we're also working collectively with the Office of Behavioral Health around services for children and families. So we have the certified community behavioral health clinics, which I know has come before the legislature and this committee has invested in, crisis services, treatment intensive homes, the psychiatric residential treatment facility, Wraparound Maine, substance use disorder services. And so collectively as a department, we are all working together to stand up those services and make sure that they're available to the different populations of individuals that we serve. Related to increasing well-being, the first topic is the psychotropic medication process implementation. So this is part of a legal agreement that the department entered into. And we are still in the process of hiring our implementation reviewer or our evaluator. It went out for RFP and we selected an evaluator that was appealed, and so we're doing the process again as part of that appeal. But in the meantime, we have taken a lot of steps to build the infrastructure underneath achieving the goals that are outlined in the legal agreement. So we have updated our policy. We have provided training to all of our staff related to psychotropic medication administration. We have a training available for our resource parents. And those trainings, we've provided them to current staff and resource parents. It's going to be embedded into their onboarding training, the foundations training for both of those groups of staff that they'll get just as a regular part of becoming a resource parent and becoming a child protective caseworker. As part of updating policy, we also created a practice guide for caseworkers and a responsibilities chart. So that outlines in a more succinct way than the policy does. Here's what the expectations are, and here's who's responsible for what. We've updated our informed consent form. We got some feedback actually from medical providers about what would make the form better. And so we've been able to take that and are in the process of updating it with that feedback. The informed consent form requires that our caseworkers are learning, the recommendations for medications, the benefits, the disadvantages of medication, and then making informed decisions. That youth 14 and older are also part of that decision-making process, and parents and caregivers as well. We have created an internal and an external website. So we have both of those available internally. It's a place where our staff can go and with a click of the button, have those resources at their fingertips. And then externally, it'll be a resource for community partners. And we've started to look at our data as well and having a plan for how we're going to collect the data and provide it to the evaluator. Related to the plan of safe care for infants affected by prenatal substance use, we've continued the work of the work group. So there was 2 pieces of legislation that came before this committee last session. And one of the things that we agreed to do was to convene a work group to really build the rules related to the federal statute and how to operationalize our practice. So we have had a statutory update. We're working on the rules, and really there's been a lot of focus on family engagement through removing stigma for individuals who have a child that is born substance exposed. And then I just wanted to mention educational neglect and truancy. I appreciate that this has been an issue that the Child Welfare Ombudsman has lifted up. We've had some conversations, so we continue to meet monthly. We, I think, finalized our response to her report today. And so I don't know if it's been posted yet or not, but it'll be posted on our website. I think, we've had some conversations about really the practice within OCFS. We have an intern that we are assigning to do some national research around this, to look at both concepts of educational neglect and then also truancy. Truancy definitely can be a risk factor for other things that are going on within a family. And so we want to be mindful about that. We want to have really good information when our staff are making decisions. And so I look forward to continuing to discuss this issue and to digging into it more to better understand, the national landscape, and then ways that we can consider the Ombudsman's recommendations and what to move forward moving into this year.
Director Johnson, is truancy a part of the structured decision-making tool?
I believe it is, but I would have to confirm that. We had a statute change a few years ago that really defined truancy for child abuse and neglect purposes when it is the result of neglect by a person responsible for the child. That language was added in, which I think goes to, Representative Zager, when you were talking earlier, a lot of the examples that I think the Child Welfare Ombudsman identified were families with really complex cases. Throughout the year, she's brought some of those to my attention, and there's been times when I have wondered if an earlier intervention might have made a difference for a child. And so I think those are some of the things we have to continue to be mindful about and to think through. Truancy is missing school. Educational neglect isn't the umbrella under which that fits. And so there's often a lot more going on with a family that is important to consider as we think about truancy as a red flag for some of what might be happening. And I think it also connects back to the information that we get or we don't get. So if all we're getting is that a child is missing school, that's different than I think some of the other information that goes along with the screening decisions that my staff are making.
Thank you.
So under navigating policy, I've talked a little bit about some of these items. So for the psychotropic medication policy, we did develop a companion practice guide. We've asked staff for for feedback on that tool and whether that's something they would like us to create for other policies that we are updating or developing. The internal and external websites. We are continuing to look at how we streamline the policy development process. We are committed to continuing to update all of our policies, but then also making adjustments as needed. And that's one of the things that we wanted to be more adept at was, as new information is learned or things need to be updated, being able to do that in a quicker way that's more responsive to the needs of staff. And so we're working on finalizing our policy implementation plan. Under engaging the workforce, our recruitment and retention specialist is convening retention work groups. And so she's starting with our support staff, so case aides, clerical staff, other types of support staff. She has been doing district meetings with those support staff to identify areas of challenge, ways to acknowledge and help them feel valued in their jobs, and what contributes to turnover. We also have been committed to evaluating and strengthening our communication pathways within the Office of Child and Family Services and have built a lot on the PCG organizational assessment that was conducted in 2023. Some of the ways that we've done this is through our continued district visits. So in November and December, myself, our deputy director, our associate director for child welfare services, and our field manager went out to all of the district offices. We visited with them. We structured it a little bit differently this time. One of the things when I have been doing these visits that has been a request of staff is to learn more about even the services that exist within the Office of Child and Family Services. And so we structured them as OCFS visits instead of child welfare visits, and then meeting with those separate distinct divisions within OCFS. The AAGs are a regular part of those meetings. And so AAG Piers Gamble has joined me in a lot of those meetings. We invite the local AAGs to participate in those meetings, which they do. They have also convened their own district visits this year. And so they were able to really hear from staff and provide information to staff about the legal aspects of the work and the ways that they can support them well. They've also met with our after-hours children emergency services workers and with our child protective intake hotline staff to talk about their needs when it comes to legal types of issues. We have started, so we launched our Executive Management Team Advisory Committee. And so this is a group of staff that represent OCFS. We had, I think it was 59 applications for 12 positions to sit on the committee. In December, we convened the chair. So there's 2 chairs that are staff that will help facilitate the meetings. And then had our launch meeting with all of the staff that will be part of that. They'll be meeting with myself, with our deputy director, and with our chief financial officer. And then we'll bring in other leadership as topics suggest. I'm really excited because I think this is a chance for us to bring topics to the group, but also for the group to bring topics to us that there are challenges with, or, we've also committed to sharing successes so that if something's happening, I know the Child Welfare Ombudsman had talked about practice seems inconsistent throughout the state sometimes. So if something's happening in a district where there's a lot of success, we want to build on that. We want to model that in other parts of the state and learn about that. So the committee will serve from January until December, and then October, November, we'll start selecting the next committee that will step in and serve in 2027. We also have been disseminating an OCFS monthly bulletin. So every month, the first week of the month, we send a bulletin out that highlights what's happening within OCFS. And again, that's something we've asked for feedback for. And then also for the last several months, I have done a Hopes and Horizons drop-in meeting. So it's a time when staff can just virtually drop in to meet with me about any topic, anything. We've talked about lots of different things. A lot of it has been that cross-office information sharing. So it hasn't just been me answering questions, but it's been the group sharing information across the office, which has been really nice. So those are some of the things that we're doing to improve communication. The next slide is about caseworker retention. And so there are two different charts here. And I just wanted to quickly mention, so the first chart is talking about turnover of caseworker staff. And turnover measures the percentage of employees who leave an organization over a specific period of time and then are replaced. So this really is speaking to the retention of staff. Turnover leads to what's on the next chart, which is vacancies. And vacancies are unfilled positions, hiring gaps. It can identify bottlenecks in the hiring processes or where there might be lack of qualified candidates. And so as you can see on this chart, in 2020, our turnover was very low, and then it peaked in 21, and then we've seen a gradual decline. And the same has been true for our vacancies. When I met with my district managers this morning, one of them gave me this beautiful chart. She was very pleased. This is the program administrator for Lewiston gave me this chart and said, Bobby, we are down to 10 vacancies. And that's been a lot of work. Yeah, that was the toughest one. And so she was happy to report that to me this morning. And there's been a lot of work, not just to hire, but also to figure out how to retain staff. The field operations manager has worked with leaders in that district to, again, pull together a group of staff to talk about why are people leaving? What is resulting in people leaving? What would help them to be able to stay? And so they've been digging in to understand the root causes of that. Additional OCFS updates. So these are our other business operation divisions within OCFS. And so within the early care and education division, I know Mariette spoke about this earlier, but increasing awareness of Help Me Grow resources so that we can ensure a comprehensive statewide coordinated system of early identification, referral, and follow-up for children and their families from prenatal care up to the age of 8, so elementary school. We're also evaluating, we've had evaluations done of current efforts to increase financial security for early childhood educators. They're critically important staff in the whole, childcare continuum. And so we want to make sure that we are providing support to them in the ways that are going to help them to stay in those positions. And then also looking at the quality of care. And so we've done that through funding quality improvement awards through the preschool development grant. The preschool development grant just ended, and the Department of Education applied for an additional year for that grant. And we just learned that that was awarded. So we'll be able to continue some of the work that we'd started under the 4-year grant. In children's licensing and investigation services, focused on updating and enhancing the plan for onboarding and meeting the annual training needs of out-of-home investigators. And then also updating the rules for psychiatric residential treatment facilities and developing rules for the treatment intensive home has been the work that's been happening. And with the Violence Intervention and Response Program, we continue to partner with the University of New England to provide foundational training for sexual assault forensic examiners, nurses, and then also to partner with our sexual assault and domestic violence service providers around the overall decline in federal grant dollars for these services and the instability. And
fingers crossed that we may be able to, that may be stabilizing a little bit, but really thinking how we continue to do the work when there's either instability or decreases in those resources available. And then at the federal level, there's been a lot happening, which I'm sure people are aware of. So childcare funding. So we've been closely following the recent information that's been coming from the federal government regarding federal funding for childcare. So it is our Child Care Development Fund resources that we get from the federal government that fund the childcare affordability program. We also, this was a couple of years ago, there were new federal rules that were established that states needed to implement. And so on January 5th, there was a proposal to roll back some of those rules. At this point, they are not mandated. So, you know, like pay by enrollment instead of attendance, and then paying prospectively instead of after the services were provided. That's something that we built into our Baxter system. And so Maine is already doing that. So we'll continue to track and look at what's happening at the federal level related to childcare. At this point, we have to provide additional justification. So we have to defend the spend in order to draw down the CCDF dollars for the Child Care Affordability Program. Another thing that's come from the federal government is a home for every child. And so this is on the child welfare side. So Assistant Secretary for Family Support, Alex Adams, has announced this new initiative to increase the number of resources. So for every child in care, there should be at least one home available for them. I've participated in some of his webinars, and what he's talked about is, I want homes waiting for kids, not kids waiting for homes. And so we're learning more about his vision. I think it aligns with a lot of Maine's vision, a lot of our vision related to prioritizing kinship care, recruitment and retention of existing resource homes, and recruitment of new homes. And so that's something that we'll be working on. And then this year in October of 26, we have our Child and Family Services review. And so that is a review that happens about every 4 years for all states across the country. We've provided some information about it previously. We are in the process right now of pulling together stakeholder groups and developing what's called the statewide assessment. So we need to do our own assessment of our strengths and our challenges, our data, and our own strategies that we're planning to implement to improve practice. The stakeholder work is being done in partnership with the Court Improvement Project at the Maine Judicial Branch. So we have that connection, and Caroline Hova is part of our meetings with our federal partners at ACF. We, an interesting, I think, new piece of information, there's a report, I think it was 25 years of Child and Family Services review data. And the brief talked about that they haven't seen a lot of improvement with the current Child and Family Services review process. And so Assistant Secretary Adams has recently proposed that states can do instead of doing the traditional program improvement plan process, which we would do when our review was done. So our review will be conducted from October until the end of March of 27. They can focus on some specific areas that states are struggling with, and have a more focused program improvement plan instead of all of the items that traditionally over the 4 rounds that they've done these reviews, they've not seen improvement as a result of this process. So I appreciate the federal government's willingness to look at the process and to make some adaptations while they continue to evaluate and assess what might be a better way to look at state practice. Yes.
I guess one of the questions related to this federal updates, are we getting any questions about potential fraud for example, our childcare? Or
Maine has not specifically had any correspondence. There's been 5 different states that have had inquiries from the federal government. Maine is not one of them yet.
I think our Baxter system has a lot of checks and balances built in that help us to be able to guard against fraud.
Great, thank you.
I don't know that that means we won't get the letter.
So, go ahead.
Thank you, Chair. Thank you for your presentation. And it sounds like you guys have a number of really promising initiatives underway, so it's really exciting. I just want to get back to the caseworker retention and request a little additional information, or also ask you to speak to a few things. Would you be able to provide district by district caseworker retention vacancy rate information for the past few years, just to give us a little sense of context for the Lewiston number?
Yes.
And then can you also speak to the ongoing impact of the Farmington office, and if you're still considering the Rumford office?
Yes. So actually I skipped my notes on this page. So we can provide it by district. Lewiston still has the highest number of vacancies across the state. The other percentage-wise district that's the highest is Rockland. They have 5 vacancies right now. And so they're a smaller district, so 5 is pretty significant for that area. And it's another area of the state we continue to be challenged in. So across the state, we have 33 caseworker vacancies. We have 2 supervisor vacancies. One is in Lewiston and one is in Rockland. And then we have 5 case aide vacancies, 2 in Portland, 2 in Lewiston, and 1 in Washington, Hancock counties. And then, I'm sorry, the second part of your question.
Are you still considering the Rumford office, and can you speak to the impact of the Farmington office?
Yeah, so we have fully stood up the Farmington office, and we have a child protective unit that's housed there. So we have 4 child protective investigation caseworkers and a supervisor. I don't have a lot of data yet about the outcomes. I think that we continue to look at, are there other areas either within the Lewiston district area or even other parts of the state where we might want to stand up satellite offices to support the work of staff and the travel, but we have not made any final decisions about an office in the Rumford area.
Director Johnson, you were here when I made mention to Ms. Simonson about some of the numbers that are repeatedly offered up to this committee and other committees with regard to fatalities, child fatalities. And while there's been an effort on your part and on my part and other members of the legislature to bring some continued clarity around the nature of those fatalities. Once again, I'm going to ask that you help the committee, anyone listening, to a better understanding of those losses, some of the misinformation that is repeatedly disseminated here in the legislature, and a better understanding of the categories of fatalities.
Thank you. I'd be happy to. Any tragedy of any child death that occurs in our state is a tragedy. And for the department, we take that seriously and as an opportunity to learn whatever we can as a system to improve services, supports to families. I did include some slides at the end of the slide deck about our child fatality reporting dashboard. And so this is a dashboard that we have available to the public, and I will just walk through it. So there are 6 categories of fatalities that are identified by the Office of the Chief Medical Examiner. So accidental, which includes causes such as motor vehicle accidents, drowning, fires, homicide. Natural, so includes fatalities caused by other medical conditions, most generally. Others includes fatalities identified by the Office of the Chief Medical Examiner that are due to undetermined causes or death as a result of a suicide. Unsafe sleep, and then sudden unexplained infant death. So those are the 6 categories of information that is captured on the OCFS dashboard.
Bobby, in looking at the dashboard, I just pulled it up. It's only showing 4 children's deaths so far in 2025. And it looks like that's just the first quarter results. I don't know if it's been updated, for at least the third quarter. I don't know.
Yeah, I'll have to look
Yeah,
at.
because I just pulled it up, to look at that, and it looked like it's just the first quarter.
Yeah, I'll have to, I
Okay.
was wondering that this morning, when was the last time that we had
Yeah,
updated it?
yeah.
Because I know we did an update before I came and presented to this committee. We did it on the same day. So that would have been in May, I think.
So which would have been probably the first
The
quarter.
first quarter of
So we maybe
data.
need to update. I mean,
So
I
I
know we
think-
wouldn't have the fourth quarter yet, but at least the
Correct, but
third
we
quarter.
should have second and third
Yeah,
quarter data.
exactly. Okay.
Yeah, so we can get
Okay,
that
that'd be
information and
Yeah.
then provide that to the committee.
Do we know our numbers, or we're gonna have to get back with us?
I'll have to get back to you. I
Okay.
don't know that off the top
Yeah.
of my head.
Yeah, I understand. Thank you.
So what is not included in the dashboard? What is included is any child fatality determined to be a homicide by the OCME, regardless of whether there is a child protective history. Any fatality that has a finding of abuse or neglect associated with the death, regardless of whether there is a child protective history. And any child fatality where the family has prior history with the department. So this includes history before and after that child's birth as well. And it can be for any type of death. And what is not included is a comprehensive list of all child deaths in Maine. So this is just a small subset of the child deaths that occur and are reported to us through the OCME or through our own reports that we receive. Not all child fatalities are referred to the OCME. So a death of a child from a known medical condition where the physician certifies the death does not go through the OCME's office. And some child fatalities known to the public in the department are not included in the dashboard due to pending criminal investigation or prosecution. So there may be a time when it looks like there might be deaths missing, and that might be the reason. And then you'll see an increase in a prior quarter because we've added those in once that criminal investigation and prosecution process is completed. Some information is redacted at the direction of the Office of the Maine Attorney General because the manner of death is still listed as pending by the medical examiner's office or because there is a pending criminal proceeding. Those that fall under the criteria noted above will be added at an appropriate time. So that's what I was just saying about, you might see updates to a prior quarter because something has been resolved through the criminal justice system. And the list doesn't include child fatalities when there's no departmental or law enforcement involvement. So some common misconceptions or misinformation that I think has been shared with the public is that the data only includes children who died while in DHHS custody. And that is not accurate at all. That the data only includes fatalities due to abuse and or neglect, and that there's a clear direct or proximate cause between the family's history with OCFS and the fatality. And so it could be that there was a history with OCFS many, many years prior, and then there's a child fatality that occurs that may or may not be abuse or neglect related for the fatality, but may not also not be related to a family's prior history. And this history, I will just say, includes reports. So if we get a report and it's screened out, it includes that information as well. My team did put together the information on the next slide, which I was hoping might help also provide some clarity. So the manner of death. So this shows from 2015 to 2024, the number of, there were 21, so it shows the number of deaths that occurred in each of the different categories that were reported. One thing that I would note for unsafe sleep and for sudden unexplained infant death is that those are specific to infants. And so there's a very small population of children that are captured in those two categories. So for unsafe sleep, there were 16. For homicide, there was 21. Other, 33. Suid, 34. Natural, 35. And accidental was 58. And just a reminder that the dashboard reflects deaths of children with some history of child welfare involvement, not just those in custody or with an open investigation. And then this last chart reflects what was presented during the Child Death and Serious Injury Review Panel presentation about data on abuse and neglect. So this is from 2022. There were 31 children with some history of child welfare involvement that died in our state. And I think that is that's one of the data points that I continue to hear in the media that is misrepresented. And so if you look on this chart, it shows that Maine is in the lower end of the continuum for the percentage or the average of child fatalities that we have per 100,000 children in our state at 1.21. And then the national average is 2.73. So we're well below the national average.
Well, I thank you for including that information. It's frustrating to me personally to repeatedly hear numbers without factual context associated with it.
Yeah, and I think, just one other piece of information that I would share about the harm that happens when the data is misrepresented. And I think I've said this to the committee before, is really two things. One, when people hear that 31 children in 2022 in state care died, it makes it more difficult for my staff to do their work and to actually identify children that are unsafe and to keep them safe, because we have experienced providers that are reluctant to give us information, families, understandably, who are more fearful that if they're involved with the child welfare system and their child is in care, that their child could die, that if 31 children in a year died. And so we have families that are more resistant or unwilling to work with us. And the only way we can make really good factually supported decisions is by getting good information from families themselves, from providers, and others that are connected to those individuals. So it's harmful. And, I just think it's really important that we understand the data and are reporting it accurately.
Representative Zager.
Thank you, ma'am. Madam Chair. Technical question. NEKC, I think, reports 14 and under. Is this data 14 under or 18 and under?
18 and under.
Okay, so that would explain why there's a little bit of
Under 18, yes.
Okay,
Yeah.
thank you.
So that would be a reason why the data may not align.
Thank you.
Representative McKay.
Thank you. Going back to page 5, do you think that you could provide a little bit more information on how much funding you have available to keep families to address barriers to permanency? You mentioned helping families with last month's rent security. Could you give us a sense of how much kind of flexible money you have to help people stay in their homes?
Sure. So the legislature appropriated $200,000 per year. It's carrying dollars. And that is really for families where we are working with them in an investigation. So if we identify poverty issues during investigation or issues that we can help them resolve really quickly that might remediate the child abuse and neglect concerns. And then also during child home placement. So when a child is returning home for their child home placement prior to legal reunification happening, that's the other place where we are using those resources.
Can I ask a follow-up?
Certainly.
Can you just provide more information at a future date about how many families, what types of funding, and is that number sufficient?
Yes,
Thank
you. I can say that we have not been using the full allotment to date. And so there's
there's room to provide assistance to other families as well. And we continue to help make sure our staff understand that these resources are available, and how to access them and ways to use them.
Senator?
Just one other question too, Bobby. Part of the DOJ settlement was that to provide an evaluation of all the kids that were in this, all the children that were in the system. How are we coming on that portion of the requirement?
I do not have the answer to that question.
Yeah, just curious to see.
Yeah, we continue to, we continue to be involved with, the different systems, so Department of Education, Department of Corrections, and then the offices within DHHS.
Right.
But I don't have an update on that specific.
Because since that was part of the
strategy.
DOJ plan, that's
Correct.
a requirement, I should say. Yeah.
Yes.
Okay. Thank you.
Seeing no other questions,
Can I just end with one
You
story
may.
that was shared with me this morning?
please do.
I told my staff that I would. So I was, when I was down in our Ellsworth office a few weeks ago, this was before Christmas, I had the chance to think through with my associate director of child welfare and the field operations manager a case that, and to really kind of think about it through a different lens. And so it was a couple young children not served out of that office, but served out of Southern Maine. There was a placement issue. We were still trying to gather information about some concerns related to substance use disorder. And then there were also some poverty-related issues. And so in brainstorming around this family, we came up with some ways to support the poverty-related issues. And we were hoping that the substance-related information that we got was going to be such that we would also be able to look at how we could prevent removal and leave these children with their parent who was very skilled at managing their behaviors. They had some behavioral health issues, some mental health issues. That didn't end up happening. But today, when I met with my team, what they shared with me was that they were able to pull together a larger team. And these were two young people that were really hard to place. They were going to be in a hotel with my staff. And through their work, they were able to bring 7 teachers to the table that were interested in being a placement resource for these kids. And so it was just amazing that through their work, it wasn't the outcome that we had hoped for, but we were able to help this mom with some of the poverty-related issues. We got more information about the substance use stuff and we're able to develop a plan around that. And then over a few weeks was able to find placement resources for these boys that is it's people that they're connected to. It's people that are gonna remain a support for them and their family. And so I just wanted to highlight, because I think that's a good example of the work that my staff are doing in the field every single day to bring supports together, to bring the community together on behalf of children and parents in order to have really positive outcomes. So I just told my staff I was going to share that.
Well, thank you for sharing that.
others.
And please, on behalf of this committee, share with your staff statewide how much we appreciate the work they're doing. It is by far the most difficult job in state government. We are aware of that. And grateful that they are attracted to the jobs and hope they remain in them.
Me too. Great. Thank you so much. And, like the child fatality dashboard, if there's ever a time when you want me to come before the committee to share specific information about any topic, I'm happy to do that.
Thank you, Director Johnson.
Thank you.
I don't think there's anyone else on our list for today. And we've got nothing else on our agenda. So with that, I would entertain a motion to adjourn.
I'll make that motion.
Okay, and we'll see you next week.
That was even with the fire alarm. I'm sorry.